All right, ladies and gentlemen, we'd like to call the room to order. I hope tea, coffee, whichever beverage you decided to take has boosted our energy levels for this next part of the program. So this is the exciting bit because we get to dig a bit deeper into the case studies. This is the first one of the 6 that were carried out in 5 African countries, and we will be turning our focus and our lens to South Africa. And in this particular case study, they were looking at labor market and unpaid childcare trajectories by gender during the COVID-19 pandemic in South Africa, and just some of the lessons that we can grasp from that experience. Before I introduce the presenter of that particular case study, just a quick reminder for the hashtags gender smart policies, and the other hashtag is feminist futures. So any pictures, anything interesting that you've heard, kindly use those hashtags. You can also tag Oxfam Pan Africa, and we also have the program streaming live on Oxfam Pan Africa YouTube channel. So anyone who's not with us physically, kindly share that link with them. Once again, you can find this on Oxfam Pan Africa YouTube channel. Welcome once again to our online audience as well. Apologies for keeping you, but we enjoyed tea on your behalf. I hope you got some wherever you are linking in from. Great. So introducing our first presenter, Jacqueline Mosomi, who's joining us virtually. And this was co-authored with Amy Thornton from the University of Cape Town. But we'll hear from Jacqueline just to give us a few insights into the case study, the findings, and then after which I will introduce the panel discussion following Jacqueline's presentation. So Jacqueline, I hope you are online. You can hear me loud and clear. The floor is yours.
Thank you, Victoria. I can hear you. Good morning to everyone. I'm trying to share my screen. I'm unable to. Maybe the technical team can help me out.
Okay, Jacqueline, I think you are able to share your screen now.
Yes. Is it a full screen that people can see? Hello?
You can switch it to a full screen.
Okay.
There should be a feature there so we can get it a bit more visible. Or the slideshow function within your PowerPoint. That's better.
Well, thank you. Sorry for that. So my name is Jacqueline Mosomi. I'm a researcher at the University of Cape Town at the Southern Africa Labour and Development Research Unit. The work I'm presenting is on labour market and unpaid care trajectories by gender during the COVID-19 pandemic. My co-author is Amy Thornton, who's a colleague at the University of Cape Town, who's not able to join us today because she's on leave. I'm happy to be here. Thank you so much for hosting this event. So the motivation for this work was the lockdowns during COVID-19. And as everyone is aware, the closure of schools and the closure of non-essential work meant that people needed to stay at home. And so parents had a time challenge. So they had to divide their time between care work and office work or labor market work for those who could keep on working. And so South Africa was one of the countries that had some of the most difficult lockdowns around the world, in that there was total shutdown of the economy and only work that was termed as essential could be carried out. And so what we wanted to find out is, how did this shock of increased care work due to closure of schools impact labor market trajectories? So we utilized labor force surveys that are nationally representative. So this is the QLFS, the quarterly labor force surveys. So we track the changes that happened from 2020 Q1 to 2021 Q1. We also, to look at just what happened to the need for childcare and increased intensity of childcare, we utilized a nationally representative survey, which is the Needs CRAM, which is a much smaller survey, but it was collected rapidly because of the nature of the pandemic. People needed a lot of information in a very tight schedule. So we utilized this survey because individuals were asked what happened within the households in terms of childcare. So our main findings are that by the first quarter of 2021, we had about 500,000, more than 500,000 women still out of the labor force, compared to about 400,000 men. So what we find, and what is different from earlier studies that found out that 2/3 of the jobs lost were by women. So the QLFS was collected a little slower, found that yes, men and women both lost a high number of jobs, but because we know that even before the lockdown, women were less likely to be employed, and they were more likely to be unemployed or be out of the labor force. So even if both men and women lost an almost equal share of jobs, women lost a higher share. So that is about 15% compared to about 13% for men. So the fact that there are still many more women who are still out of the labor force currently, this has led to a slight increase in the gender gap in labor force participation, which, as most studies in early 2020 projected, that this COVID-19 pandemic was actually a recession that mostly affected women, that it was going to set us back in terms of the gains women had made over time in closing the gender gaps in the labor market. What we find also is that women were more likely than men to follow trajectories that saw them permanently switching out of employment during lockdown, and I will discuss this further. All these are connected to the types of jobs women did and which industries were more likely to be affected. So women are concentrated in the services industries, and these were some of the industries that were termed as non-essential, in that a lot of jobs in these industries, a lot of occupations closed down during the pandemic. So whereas we can look at the aggregate picture, we know that in the context of South Africa, it's quite mixed, and women are not homogeneous, and men and women are not homogeneous. So when we try to disaggregate this and look into the different subpopulations, we see that the most affected subpopulation was the Black African subpopulation. And this is where you find some of the lowest employment figures, and it happens to be the majority of the country. So what we find here is that in terms of dropping out of the labor force, or in terms of job loss, this is the subpopulation that was affected most. And what we see here is that the increase in the labor force participation seems to be larger amongst the Black subpopulation compared to the other subgroups. What this means is that any policies that are going to be put in place in terms of trying to mitigate the impact of COVID-19 pandemic, we have to be intentional and we have to target to the most affected populations. And what a lot of studies and also what this study shows is that people who are vulnerable before the pandemic, so these are young people, these are women and Black women in particular, they were the ones that were most affected by the impact of the COVID-19 pandemic. And this is coming from the fact that, while we know that there is gender segregation in terms of the jobs men and women do, so literature shows that women are more likely to be in part-time employment, women are more likely to be in the services sector, women are more likely to be in the jobs that are termed in the lower cadre or in the lower low income distribution jobs. We also find that there is segregation in terms of race. So then Black people are more likely to be in the service or elementary occupations. And these were the occupations that were affected by closures during the pandemic. So when we look at what happened to the number of hours that people were spending on childcare, so when we disaggregate between employed and not employed and people, specifically people who were living with children, people who reported that they were living with children in the household. So what figure 2 shows is that, so we were able to trace back to February. So this is before the pandemic, so February 2020. So when we look at April 2020, we see a sharp increase in the number of hours that people who are living with children were spending on childcare. And this is the same, the increase can be seen for both men and women, for both employed and not employed. But what the figure shows us is that the jump in the number of hours spent in childcare was much higher for women than for men. And what we see here, so April was the toughest part of the lockdown. It was called the hard lockdown, so meaning everything was closed down, schools, non-essential occupations, non-essential industries, and we all had to stay at home. And those whose jobs could be done from home continued to work from home. But also what the data shows is that only a very small proportion of South Africans could work from home, about just slightly above 10% of the population are in occupations that can actually be carried out from home. And these are the jobs at the top of the wage distribution. So these are your managers, these are your clerical officers, and these are your professionals. Even some students could continue learning from home. But this is if you are in a well-equipped school, and this is if you come from a household where you can afford, you have electricity and you have stuff that can help you carry on working. So you have access to a laptop, you have access to Wi-Fi, you have access to internet. And so only a small proportion of the country can actually have access to this. And so what this means is that if you're poor and if you are in an occupation that you could not continue working from home, then this means that you either lost your job or you reduced the number of hours that you are actually working. And what the data showed was that during this hardest part of the lockdown, what happened was, because the pre-COVID times, there was a higher share of women in part-time employment. So what happened during the lockdown was that this share of part-time employment went down for women, but then increased for men. So you had men who were in full-time employment reducing their hours. So this is where we are finding that there are still more women out of the labor force because they were working part-time before, and now they are out of the labor force completely. And so what this meant was that if you lost your job and you were and the number of hours you're spending on childcare increased. This meant that you were tied down and you could not go out and look for a job. Whereas if you are a woman and you could work from home, this meant that your productivity was affected, because then you're trying to juggle between looking after the kids, looking after the house, and still trying to, be productive with your work. So in conclusion, what this study showed was that for the women that have dropped out of the labor force and stayed out, getting them back will require interventions that can take care of the issues. So that is childcare. If we provide childcare, then we release this, the amount of time these women can spend looking for employment. Also, expansion of childcare will increase the opportunity of employment, as we know that this is a highly female-concentrated sector. So also better working conditions. As I have mentioned, pre-COVID-19 is that women are more likely to be in part-time employment or be in informal employment, which means is that some women would like to work full-time, but because either of childcare or just because of underemployment, they work a few hours. And so these are the women who found it easier to just drop out of the labor market completely. So improving working conditions, so that is increasing, improving contract and making sure that women have access to, leave, they have access to insurance, medical insurance. These are the working conditions that can ensure that we attract women back into the labor market and keep them in the labor market. Another issue that could help in getting women back into the labor market is flexible working environments. So this means that women are able to work from where they can and also work during the hours that they can. Transport is a big issue for women, and especially who are women who stay far from where they work, and they have to spend long hours in transit to their places of work. So I've mentioned form of contracts, and I've also mentioned a living wage. So pre-COVID-19, some of the arguments for the still persistent gender wage gap in the labor market are things like, male employment is tougher. They have, they spend a lot of hours working, in very tough conditions. What COVID-19 showed us was that female employment is also quite unsafe. So women were in occupations that were in close proximity to catching the virus. So they are your shop clerks, they are your supermarket servers. So these were the people, they your nurses. These are the people who were more likely to come into contact with the virus. So the fact that male employment is tougher than female employment is no longer an argument for paying women a non-living wage. So the second conclusion and policy lesson is that given that during COVID-19, the majority of ECD centers were closed, this brought to the fore just how essential these facilities are in terms of freeing up women to provide more hours to the labor market. And so in South Africa, a lot of ECD centers are unregistered, and this makes it difficult for them to, it made it difficult for them to access any relief that the government was providing during the COVID-19 pandemic. So this meant that people who worked in the ECD centers were left unprotected, most of whom were women. And so there is need for regulation of the ECD sector. There is need for expansion. And then there is also need for more subsidization of this sector in terms of allowing more people to access ECD center services. This will expand employment, and it will also free up women in terms of hours allocated to the labor market. The third thing that came to the fore that we have always talked about was social norms and stereotypes in terms of occupations and in terms of childcare. So over time, we have seen that there are more girls joining some of the STEM occupations that were considered to be a reserve for men. And so what needs to happen is that there needs to be more campaigns in terms of changing social norms, in terms of sharing housework. So we have socialized girls into they can do whatever that they want to do, they have the capabilities, yet we are much more slower in socializing boys and men in terms of the sharing of work in the household. And so what needs to happen now is the conversation. So we cannot have a law that actually forces men to assist in housework or in care work. What we need to change are the social norms, because as the literature shows us that the last step into bridging this gender gap and closing the gender gap in the labor market, it's dialogue and it's the change in social norms, because for now, women are, whereas we still have occupational segregation in that some occupations are male concentrated and some occupations are female concentrated. We see women climbing this ladder and joining some of these occupations. What we are not seeing is the other half. So we need to have social norms discussions. How are we socializing boys and how are we socializing girls in terms of the sharing of the care work? I'm going to stop there and wait for the discussion. Thank you.
Thank you so much. One more round of applause for Jacqueline. And in absentia, Amy, who co-authored this particular case study on South Africa and some of the key pointers coming out of that, which will be delved into by Ruth Olo. And she is the We Care Global Oxfam project manager for that particular program. And she'll introduce her co-panelists for this particular discussion. Ruth, the floor is yours.
Everyone, my name is Ruth Olo. Like I have been introduced, I work with Oxfam International, managing a multi-country program known as Women Economic Empowerment and Care. And our business is actually to address unpaid care and domestic work, this invisible thing that makes women and girls not be able to have the choice and the agency to decide how to use their time, whether they want to rest, whether they want to go to school, whether they want to work, or whether they want to actually engage in the labor market. And I am honored to be moderating this session. And I would like to invite Lucy Minayo to the stage. We have another discussant who will join us online. So Lucy, welcome to the stage. And even as we wait for Lucy to get here, I hope our audience who are in the virtual space are able to interact with us. They're able to send their questions and also comments. Thank you very much, Dr. Jacqueline, for that particular presentation. I hope we also have Gonzak online. Is Gonzak online? The tech team? Yes, thank you. Yes. Let me just introduce my discussant. So Lucy Minayo is a Kenyan feminist human rights lawyer who has worked in the international development space for over 15 years. Presently, Lucy is the director of the Global Home-Based Childcare Initiative, which is a funding collaborative that seeks to test and scale up support programs from home-based childcare providers. The initiative, which sits at the intersection of childcare and women economic empowerment, has just started out in Kenya and will later move to Rwanda and India. So it plans to affect 100 communities in 10 years, guided by the broad mission of ensuring that childcare in home-based childcare centers settings thrive within the first 1,000 days, thus ensuring better development outcomes, that women providing these services are also recognized and make a decent living from this work, and that families have access to quality childcare in home-based settings. Let us welcome Lucy Minayo. And our next discussant will be Gonzak. Gonzak is the Economic Affairs Officer in the Gender, Poverty and Social Development Policy Division of the United Nations Economic Commissions for Africa, where his main areas of focus are on gender statistics and economic empowerment of women. He leads the ECA work on gender indices, including the Africa Gender and Development Index and the Africa Gender Index. It is a pleasure to have both of them, but just to pick from where Dr. Jacqueline has stopped, I mean, she's given us a couple of policy recommendations around what needs to be done to ensure that childcare is actually not a barrier for women to get back to the labor market. But just to say that care is really central to our well-being, we are here because some care has been offered to us. And for those that have children, and especially young children, under the age of 12, there is a study that says that women with children under the age of 12 are less likely to go to work because of childcare. But we know that care is actually the engine that runs our homes. We are here gathered in this very beautiful hotel because someone is taking care of the people that really matter to us. But then most often than not, this care, including childcare, is rather invisible, is not recognized. And most often than not, it actually presents, from Dr. Jacqueline's presentation, it actually presents as a barrier for women to get into the labor market, because they have to ask themselves, who will remain with my child? And even as we look at the women as a community, but we are also cognizant that women are not a homogeneous group. Dr. Jacqueline has been able to bring out the issues of race. She's talked about Black women specifically. She's been able to talk about women working in particular sectors. That is another intersectional thing that we really need to think about. And in the morning, we heard about women in the rural areas and women working in informal sectors. And so all these dynamics have to be brought to the core, even as we look and as we think about the whole issue of childcare. So I will start with you, Lucy. How can investments then in childcare being a very important thing, how can investments in childcare address time poverty and women re-entry in the workforce? Yeah.
I think it's still morning. Good afternoon, everyone. Good afternoon. Okay, thank you so much, Ruth. And I appreciate the invitation from Oxfam and the opportunity to participate in this high-level policy dialogue. The study, and thank you to Dr. Jacqueline and your co-author for what I consider, or we consider, a very timely study that reinforces the policy gaps and the sense of urgency insofar as childcare is concerned. I myself am a mother of 3 children. And at some point I had all 3 children were below 4 years. So I really struggled with childcare. I think it's a struggle that many mothers in the room relate with. And I was just fortunate that I had an employer that was understanding, and the gaps in employment did not predispose me to, losing my job. But I recognize that that's a privilege that a few of us benefit or enjoy. It's a privilege that a few of us enjoy. Because the women that I work with who live in the informal settlement areas in many of our countries really struggle to access quality childcare. And just to go back to the conversation, I start with a bit of statistics. So as I sit here, I hold brief for children and the women that are providing childcare to those children. In 2018, the ILO, the International Labour Organization, estimated that there are about 1.9 billion children under the age of 15 years, that including 800 million children under 6 that were in need of care globally, and they warned of a severe and unsustainable childcare crisis if that was not properly addressed. That crisis, as we saw during COVID, it's upon us. It's here with us, and it's good that we are beginning to have conversations about how we resolve that situation. Some more statistics. In 2020, the World Bank published, actually this year, they published a report that indicated that about 40%, 350 million of the world's children who are below primary school age need childcare, but they lack access. So childcare is a huge issue. Nearly 8 out of 10 of these children live in low and middle income countries. And access to childcare for children that are below the age of 3 is poor. It's difficult for children below the age of 3 to access childcare. It's very low in many of the countries that we are working in. And where countries actually have policies that attempt to address the question of childcare, demand will typically outpace supply. So going back to talking about the labor workforce and how we enable women to get back into the labor workforce. The reality, Dr. Jacqueline spoke about the gendered implications of childcare. It is women that are mostly providing, they're disproportionately impacted, and that the ones that are providing childcare in our communities, they're the ones that are caring for our children and other aspects of care. And this creates barriers to these women insofar as getting back into the workforce is concerned. What does childcare therefore do? Childcare does a number of things. It gives families, especially women, the choice to engage in the workforce and more opportunities to advance their career while having the peace of mind. I think many of you who are parents can relate, or guardians. When you have good quality childcare, you have access to good quality childcare, it gives you peace of mind. You go to work, you're not having interruptions, you're not asking for leave all the time, and you're not exposing yourself, or you're not exposed to the challenge of actually losing your job. So investments in childcare are a priority. They will actually enable women to get back into the workforce, but importantly, they will address the question of time poverty. So in this particular meeting, I'll focus on home-based childcare. A large percentage of our children are actually cared for in home-based childcare settings. And I think we all can identify with that. It's the form of childcare that we possibly benefited from when we were children. And it's popular, it's everywhere. Whether you go to the West, where about 30% of children are taken care of in those type of settings, or in the global South, where about 70 to 85% of children, it's estimated, actually taken care of in those settings. And home-based in this context means care that is provided in the home of the child, or in the home of a provider. And for purposes of this conversation, I'll focus on care that is provided in the home of the provider. So are there investments that have been made in the area of childcare? Are home-based childcare settings, are they supported? And just to paint a picture for us, home-based childcare providers, while we note that it is childcare is under-resourced, home-based childcare is actually vulnerable, particularly more vulnerable. And home-based childcare providers operate in the dark. They don't have support. They're not connected to essential services like health. They are not regulated, as we heard from Dr. Jacqueline. They don't have, and therefore, because they are not regulated, they cannot access social protection. These women are barely surviving. They are barely making a living. So they are not able to address the question of quality comprehensively. And I mean, because they are not making a living, we are essentially in a situation where childcare is subsidized by the unpaid labor of women and girls. And their services tend to be unreliable, somewhat unreliable, because they're exposed to harassment from different quarters, from the community, from officials, etc. So in 2020, this particular situation prompted us as an organization or as an initiative to undertake a study to establish what kind of investments exist, what kind of support exists for home-based childcare providers. And what we found was that there were, so we conducted this study in 10 countries, and we looked at 11 support programs. And by support programs, what we mean is initiatives that are supporting home-based childcare providers to get to a place where they're providing quality services. So these support programs, like Smart Start, which was referred to in the study, what they do is they provide training to these women. They support them to make their premises or their homes more habitable, more safe for the children. And they work a lot towards the recognition of home-based childcare providers. As you heard from Dr. Jacqueline, childcare, this kind of providers are unrecognized, they are unregulated, they're not registered, and they fall through the cracks politically. They don't have a home in the more structured form of government. So they are struggling. So in this study, we looked at the financing models. How are they able to make a living from these home-based childcare settings? One, the parents or guardians are paying for it, and the home-based childcare providers are subsidizing it in a sense. If you take a child to a home-based childcare provider without diapers or without food, the home-based childcare provider has to dig into her pocket to provide that, to provide the diaper and to provide food. Secondly, there are situations where these providers actually receive grants from these support programs, grants particularly from nonprofits. And in some few instances, they actually receive grants from government. And then finally, there is government support. In at least 2 of the providers that we looked at, or the support programs we looked at, they receive funding from the government. That was in Colombia and I think it was France. And sometimes, government funding is direct or indirect. We also looked at the challenges that these providers face, and I've hinted at some of those, but the biggest that we found was actually quality of care. How do you quantify? How do you define quality of care in home-based childcare settings? How does that look like? We don't want to convert these homes into schools or into centers. So, but how do you ensure that the children that are receiving care in those homes are actually receiving quality care? And quality care has been defined, but how do you contextualize it in a home-based childcare settings? Other challenges were that home-based childcare is viewed as a business. And in fact, if you work in the childcare sector, you come across the word microeconomic enterprises, women's microeconomic enterprises. It's all very good, but the point that we are missing is that childcare is actually a public service. And because it's viewed as private enterprise, then the investment the investments are limited. We hardly get to see investments by government. Where government supports childcare, it mostly takes the form, or the preference is for centers. So when sometimes we conflate centers with ECD facilities, those are the ones that will often get government recognition. And I think, we talked about how home-based childcare actually slips through the cracks. Politically, you find that it's nowhere. They exist in a serious vacuum. So because home-based childcare is the most common model or the form of childcare in many of our countries, and because it's the most realistic, it's actually the most realistic and attainable model for many countries in the region because it allows for contextualization. We could not associate more with the findings of the study that there has to be better and improved or increased investments. And the increased investments will likely come from the public sector, government support. So these support programs are an indicator of the kind of investments that exist and the implications of those investments on not just the women that are providing care, but the women as well who rely on these forms of care and are trying to re-enter the job market. And what the study showed was that where this support exists, women actually have choice. Choice is given back to them. And they can make better, they recover their time, and where they want to go back to employment or where they want to engage in other activities, they are able to do that. But for the women that are providing childcare themselves, what it does for them is this support enables them to make a living from their work, to not be providing care that is, philanthropic, to move away from philanthropy to actually receiving compensation for their work. Now, if we are to, the question now is about scale. Public investments enable us to scale and enable the impact to be even wider and larger than what we currently are seeing. So our study was able to establish that investments in childcare could ensure that home-based childcare services are of high quality, where children are safe, they are stimulated, they can learn, they can play, and they can grow. But to achieve this on a larger scale, it needs training and funding. And this can only come from the public sector. As I said, these support programs are barely scratching the surface. They are reaching one support program in Kenya, for instance, called Kidogo. The children they are able to reach, or the women they are able to reach, it's a drop in the ocean. So there are so many children and so many women who are providing home-based childcare with little to no support at all. So they are basically existing in the context of philanthropy. They are offering services for free. So we think, I know, is time up? Okay. So investments by the government would actually scale support and create entrepreneurship and employment opportunities for women in the childcare sector. And it would create more job opportunities for women by, as I said, easing their anxieties of those living their children in home-based childcare settings, and they could then re-enter the workforce. Should I talk? Thank you.
Thanks, Lucy, for that. Some of the key things that are coming out is that childcare is actually a public good. And if it's a public good, then it is the responsibility of the government to provide childcare services. I know even as she talks about home-based childcare services, I just want to take you back to the communities that you serve, or the community that you grew up in, or that community that you have your interventions. How many public early childhood development centers do you know of, public, funded by the government? Just scan your environment, whichever country you come from. In my country, we call them nursery schools. How many public nursery schools are there? Can they be able to facilitate the number of children from those villages and from those estates that are nearby? And the more reason why, then investing in home-based childcare services needs to be done. But then Lucy has told us, and also Dr. Jacqueline has told us, that most of these centers are unregulated. So it means today it's there. And when the government is doing its rounds of ensuring quality and everything, they will close. And the children who are supposed to go to these childcare centers will not go on that day because maybe the childcare provider is sick or the government doesn't want this childcare to operate because it is not registered, it is unregulated. What will happen to the mother? The mother definitely will have to choose between remaining home with the child or finding other means of ensuring that their child gets a place for them to get to work. And those are the realities, even as we talk about labor market and all these jargons that we are using, those are the realities of most of the women that are living in the rural area and the informal settlements. But then the other thing that is coming out evidently is, yes, there is some investment. Government is trying to put in some investment, but I want to also bring to your attention, and I know most of you know, that there is also a very huge, massive investment in the childcare sector by different development actors. Talk about the World Banks, talk about other development partners. That is the direction that most development partners are taking when they are looking at the whole issue of the care economy, looking at paid care and unpaid care, but also looking at childcare specifically. Gonzak, how can we really address the care economy that childcare is a part of, that is rather invisible? No one actually talks about it, but it actually bars women in substantively participating in economic engagement and also in leadership and also in decision-making spaces for girls and also in education, all those things that you can mention. Gonzak? Gonzak, can you hear us? Tech guys, can you help us connect with Gonzak? Yeah, all right. Gonzak, you have the floor. You have 15 minutes. Sorry, we can't hear you if you're trying to speak. You're on mute.
Hello?
Yes, we can hear you. Thanks. Go on.
Hello?
Yes,
okay.
we can hear you.
Thank you very much. Thank you very much, Madam Moderator. My internet connectivity is not very strong, so if you don't mind, I will not switch off my my video to conserve my bandwidth. Thank you very much, Madam Chair, Madam Moderator Ruth, for the opportunity, and thank you for the presenter, Jacqueline and Lucy, for such clear and practical presentations. I will preface my discussion, Madam Moderator, with I will preface my presentation by saying that my discussion will be based around the policy guideline prepared by ECA on integrating gender in the care economy in post-COVID-19 recovery policies. And the aim of this policy guideline is to strengthen national policies of African countries to design and implement social protection policies with a human rights and gender perspective. I mean, just to set the scene. So before I look at the policies, which will revolve around the 5 R's of recognize, reduce, redistribute, represent, and reward. Just to set up some preliminaries first. First of all, in terms of one of the key messages that I would like to highlight from the policy guideline is that the care work, is work performed for or on behalf of others. And this can be either paid or unpaid, like you said, Madam moderator. It can be paid or unpaid. It can be within the household, and within the household, it can be done by males or females, or it can be outside households, servicing households. And also, care work can be direct care of persons. This will include caring for children, caring for the sick, providing emotional support, caring for the elderly, caring for persons with disabilities. But care work also can be indirect, providing indirect care of persons, including cooking, cleaning, laundry, household maintenance, fetching water, and collecting firewood. So this is, so that we situate ourselves, so this is the key message. So when we look at the policies, we can highlight the fact that it can be done. It has different facets. In terms of now of distribution, some statistics globally, women represent a little bit above 65% of the 380 million care workers in the world. This is global. And in Africa, 65% of all nurses are females. And the majority of unpaid care work, now we are focusing just on unpaid care work, takes place within households. And most of this unpaid care work done in households are done by women and children. Actually, if you look at the data for nationally represented tiny surveys, you'll see that between 67 and 92% of total unpaid work done, within households are done by women and girls. So this is in terms of distribution. Just to highlight some of the effects of COVID-19 pandemic on care work in general, and especially on the effects on women. Like we said, almost 3/4 of all nurses are females, and as a result of the COVID-19, you see that females were at a greater risk of exposure from COVID-19, as Dr. Jacqueline said earlier. And this resulted in a mental strain of being directly on the front line in the fight against the virus, putting their lives at risk, and so on and so forth. So this is one of the consequence of the fact that the distribution of paid care work now is concentrated on females. But also the COVID-19 also added additional burden, care burden on household in terms of caring for sick relatives, young children kept at home from school and daycare facilities, and fetching more water in terms of the disease environment. So like Dr. Jacqueline has highlighted, as a result of gender norms, the extra burden of unpaid care work as a result of COVID-19 is more likely to be borne by women and girls. And Dr. Jacqueline highlighted this very well in her study from South Africa. And one of the things that is very interesting from the study, from the presentation of Dr. Jacqueline, which was highlighted by the Madam Moderator also, was the fact that when we look at women, we need to there's not one size fits all. We need to take account of the issue of intersectionality. Dr. Jacqueline in her research highlighted the fact that Black women face the brunt of the dropout from the labor force. Wealth issue, was also an issue, and as highlighted by this morning by Lubeba and Ramapoko, the issue of rural versus urban is also an important issue we need to consider, as highlighted by Madam Moderator. So this, this in terms of the effects of COVID-19. Now, just before I look at the the various policies that the policy guideline prepared by ACA highlights, I just want here to highlight some of the policy issues from the gender perspective relative to the care economy. As has been highlighted earlier, care work is important for human well-being and societal functioning. So care work is important, and it has to be recognized. Unfortunately, like Madam Chair said, the majority of unpaid care work, done within households for the use of households are not included in national accounts. So and this is why later on we will see that there's a need, as part of recognizing the importance of unpaid care work, there's a need to measure what is happening, what is not included in national accounts, but has to be measured, recognized in terms of measurement. And this is where the time use surveys come in. But we'll discuss this a bit further when we look at the policies. Like we discussed earlier, the majority of unpaid care work is undertaken by women within households. As has been highlighted earlier, caregiving can provide personal satisfaction, for example, when caring for other family members, and it can be a result of informed individual choice. But I think what Lucy highlighted, the issue is when you don't have the choice. When you don't have the choice to decide on whether you provide care work within the house or outside of it. So this is a key issue, whether you have informed individual choice when you decide to provide care work. Because care work, yes, it can provide personal satisfaction, but it also imposes cost, both direct cost in terms of time and money and physical and emotional well-being, and also opportunity cost in terms of things that you cannot do because you are doing the care work, in terms of education, paid employment, if this is your choice, and political participation. And as we highlighted earlier, when we were looking at the distribution, the care workforce is overwhelmingly female and characterized by low wages and poor working conditions. This is something also that Dr. Jacqueline highlighted in her presentation. Now, in terms of policies, so just briefly, just to go through some of the policies for addressing care work. So again, I will look at the 5R model. First, recognize. So first of all, we need to recognize that care work is valuable work. It's valuable work, which contributes to the functioning of society and well-being of individuals. So, like we said earlier, most of the unpaid care work, which happen in the household are not included in national accounts and therefore not visible. So we need to have a way to measure them so that they are visible. And we do this by collecting time use surveys. Time use surveys, measures the time spent by individuals within households, in terms of care work, in terms of domestic work, in terms of time in the labor market, in terms of leisure, in terms of education. So the time use survey gives us a measure of the time spent on different economic activities, and kind of is a way for us to recognize the importance of especially unpaid care work, because now we can measure it at least. And the second key point in terms of recognizing care work is to take them into account when we formulate policies and make decisions. Okay, so and of course, to take them into account when formulating policies, we need to have a measure. So this is very important. This is why time use surveys is very important.
You have 2 minutes to go.
Okay, thank you. And another important issue in terms of recognizing care work is, and I think this came out very clearly, the discussions, the high-level discussions earlier, the need for national coordination of the care economy at the national level. I mean, what we found is that, you have, different policies, dealing with different aspects of the care economy. So what the policy guidelines is suggesting is the need for national coordination so that we have a coordinated approach rather than a piecemeal approach to the care economy. In terms of reduction, very quickly in the interest of time, investing in technological improvements, infrastructure developments, investing in the social care service infrastructure for children, elderly, the sick, people with disability, as has been discussed earlier, and this, of course, childcare falls under that. As both Dr. Jacqueline and Lucy highlighted, quality is important. This infrastructure in terms of care facilities, in terms of early childhood facilities, they need to be of a certain quality to ensure that parents are confident, and parents and other family members are confident where they put their loved ones in these facilities. They have peace of mind. And also, as highlighted by Lucy, how we finance this investment is also important in terms of equality. Very quick, moving on in terms of redistributing now, as we discussed earlier, care work can happen, within the households, outside of the households. It can be done by within households, by the government, by the private sector. And within the households, it can be done by men or women. So these are the key issues that we highlight. So in this case now, as highlighted by Dr. Jacqueline, there is a need for transforming gender stereotypes and changing social norms, by promoting a shared responsibility within the households. In addition to other, other interventions, such as redistributing through care supporting workplaces, like leave benefits, paid sick leave, redistributing through social protection policies, and redistributing to the market and the community. So these are the issues under redistributing. 2 more R's now. Traditionally, we had only 3 R's: recognize, reduce, and redistribute care work. Now, with the work done by ILO and Oxfam, we have 2 more R's: represent and reward. In terms of representation, the issue here is ensuring the full and equal participation of care workers and care receivers in budgetary planning and decision-making processes. This includes ensuring that the needs of women are adequately taken into account in these processes. Representation should be both at the individual level, individual representation, and at collective level. And this is where the issue of trade unions come into play, and the representation of care workers, and representation in terms of political representation, but also economic representation, having the opportunity to participate in remunerated activities outside the house, if this is the choice made by the individuals. And finally, Madam Moderator, in terms of rewarding, we saw earlier that the fact that care workers are some of the least rewarded workers, even if what they provide to society is very important. So there's a need to provide decent terms and conditions of employment and social protection, and this was something also discussed by Dr. Jacqueline. And for all, and this the policy guideline highlights the fact that all care workers should be rewarded, including those in informal work arrangements and migrant workers. And this is something that was highlighted in the high-level panel this morning. Madam Moderator Ruth, with these few words, over to you. Thank you very much. I'm happy to.
Thank you, Gonzague. Let's give Gonzague a hand of applause. Thank you. I know you've listened to our presenters and our presenter and the discussant. And I know you've noted down your comments, your question and all that. We will start with our virtual audience. Are there any questions from our virtual audience or comments so that we bring them in? We still don't have, but we encourage you to ask any questions if you have. I also want to open it up to the floor, to the people who are present here. Should mothers face the motherhood employment penalty because of lack of quality, affordable childcare services? Should they face the motherhood employment penalty? Should childcare be a barrier for them to get back to the labor force market? So I open it up to you. Any questions, any comments from the floor? Any? Yeah, we have two from that table. We have one. So we will take the two from that table, then we will go to the second table on my left, and then we will go to the back, the lady in maroon, then we will take another round. Thank you. Let's start with you, Grace. Very specific, very short questions. Thank you.
Thank you, Ruth. And my name is Grace Ngugi from Kenya. I work for an organization called Dobi Women Network. It's an organization that champions the rights of women domestic workers. And this is so dear to me. And my contribution may be to add on what Dr. Madam Lucy Minayo has presented, is to look at the budget process making, because this is all where it starts, and also to have gender responsive budgets, so that, and I'm glad that one of the researchers who is our CS is now in that docket of finance. So I think as much as we talk, we need to be part and parcel of when we are developing the budgets for the country, especially like if you are in Kenya right now, we are working on the 5-year plan for the country in every county on county development, integrated development plan. So that's where all it starts, so that when the government is planning, it has even the women perspective in mind. Thank you.
Thank you.
Thank you very much. My name again, Atkwasa Rita, and I'm a member of Parliament of Uganda. Thank you, Lucy. I like it being taken out of the education sector, because I think for many times, all these years, it is hiding. It's neither there nor there. So bringing it out mainly as a home-based care service, I think enables it to catch the eye. But I also think our governments kind of fear the mantle, because when you look at the whole process of development, early childhood development, somehow it's like a whole total missing link of a childhood, where they want to capture a child at 5 years in school and then fail to answer the question, where have they been? But since your niche is in research, I would be interested, for instance, can we develop a business case? Where are we now and what are we losing? Because as a legislator, it is a very, from a woman's side, it is a very catching thing to put on the table. But from a patriarchal side, it's like, let's be there with it. Let it choke us and let us die with it. So probably we need to take it on that angle of a business case for us to be able to entrench it. Right now in Uganda, I think about a few days ago, the judiciary dug into this thing of childcare and paid care work to cause it as a justification of how do we value it in divorce processes. I mean, for those whose marriages can't hold, divorce is imminent. So probably, and it was kind of a flipping the script. Whereas we felt as an individual initially that the judges have actually done us a disservice by saying childcare should be valued on case-by-case basis. But on another way, probably it is an angle for us to do advancing for home-based care service. So as I conclude, if we could add on to it, what is the business case that comes with it? Because that's what people seem to understand. Thank you.
Mhm. Thank you. We'll move to this side. You have the mic.
Thank you so much. My name is Awutash and I'm representing IGAT. Thank you very much for the comprehensive presentation, and we're bringing in a lot of challenges and issues that we're facing everywhere, including our also member states. So I mean, to me, it's a kind of comment, but at the same time, a question is, I clearly heard the issue of social norms. That's the issue I think that we need to try to address, because childcare should be also shared. It's not only the issue of mothers, but it should also be the issue of fathers. And there is no one way of addressing, you know, childcare and women's role in the private, in not only the private but public sphere. So I guess we need to work on trying to create supporting mechanisms at the family level, bringing in men as support mechanism, not only, you know, childcare home-based or outside, but at the same time sharing the responsibility at home, and adopting flexible kind of, you know, working hours, not only for women, but also men. But I know it requires a lot of change in terms of perceptions and understanding of who takes care of children at home. So I just wanted to bring that into the discussion. Thank you.
Thank you so much. Last one. Yes, at the back, at the other, on the other table, then we will come back to you.
Once again, thank you for the opportunity to speak. Looking at the issue of childcare and the work that women do in the home front. In the formal sector, it's easy to embrace work-life, family life balance policies. But where we have most of the problem in Africa is within the informal sector, as we have spoken. And so the issue is our ability to focus on this sector to come out strongly on a policy that will help us to address this particular sector. And I take the issue of education, for example. In Nigeria, you have a series of policies, and it starts with early childhood. We start from nursery. 1 year, if a child is 1 year old, then that child can be taken into a nursery. What happens with a child that's less than 1 year, and either the mother is working in the formal or informal, and particularly market women. You see in Nigeria, a market woman bringing 8-day-old to the marketplace. And so it's, when you then talk about pandemic and what this has done, I think the weakest link had always escape policy. So how do we bring this weakest link into the policy arena? I think these are some of the things you might need to tackle at this meeting. Thank you.
Thank you very much. Let us take that round, and then we will go for another round. So Lucy, you can take up the business case question. Can we develop a business case to this whole conversation? And then Dr. Jacqueline, you will take the other question on how does childcare look like in the informal sector, and what can we do around the policy environment on childcare? You want to start, Lucy?
Yes. So thank you, Ruth, and thank you to the Honorable the Honorable MP, Rita, for your question. I wouldn't have a direct or a comprehensive response or a final response to that question. It's the challenge with childcare is we already see in all our communities, we see the barrier before we see the solution. So one of the things that we are doing, it's precisely why the Home-Based Childcare Initiative was created. It was to demonstrate that with a systems approach, that if we understood the ecosystem within which childcare is carried out, who the players are, how they relate to each other, how, the dynamics, who are supporting, etc., that we can actually systematically, systemically, and sustainably resolve the challenges that many individuals are facing because they don't have access to childcare. So we have started in Kenya. We want to evaluate the ecosystem. We want to understand who are these people that are conducting home-based childcare, who are supporting them, where does the government come in, how many children are in those facilities or those settings, how many women and men, because we are actually encountering men providing home-based childcare, how many are providing this care, what are the gaps, and then to work with them to identify what change opportunities exist. And I think one of the most significant change opportunities that's presenting to us is policy. We see in Kenya, for instance, that childcare is a devolved function, meaning it is happening at the sub-national level. And so we have county governments, those sub-national governments, developing, actually addressing their minds to the question of childcare. So they are developing policies and they are thinking through how a county-based childcare model would look like. When government is supporting the centers, who accesses that form of childcare? We are working with them to think through recognition of childcare workers. We believe that this work that we'll conduct in Kenya, Rwanda, and India, and hopefully in 100 other communities, will be useful, that there'll be important lessons to actually extrapolate to countries in the region, say Uganda. We are hoping that we can influence Uganda to actually do something and address the question of childcare. But we need to understand what's happening in the sector, in the ecosystem, to design approaches that I think can be applied and adopted across the region. Thank you.
Thank you, Lucy. Dr. Jacqueline, the next question.
Thank you, Ruth. And thank you for the question. And I think the reason, I understand where the question is coming from, and the reason why we are differentiating between informal women and formal women is that whereas it's difficult to find care, and whereas care prevents women in the formal labor market to go to work, there is a notion that at least women in the formal labor market can afford care. So it's like if you have a job, you either can afford a domestic worker, or you can afford to take your child to either a home-based care or an early childhood center. Whereas if you're a woman in the informal sector, you are constricted in terms of resources as well. So your poverty means that you cannot afford to stay home. And it also means you cannot afford to take your child to be taken care of by someone else. So you find poor women who are domestic workers themselves, they go with their child to their places of work. Or if you're a small scale, market woman, then you go with your child to the market. So the solution is simple here. We do not need to differentiate between, we would not need to differentiate between informal sector women and formal sector women if childcare was universal. Therefore, that the government was taking responsibility of providing affordable, or, you know, in the best case scenario, free childcare to every child. So does not matter where you fall in terms of the income distribution. So poor women, rich women, all children are entitled to free childcare. So then if the government took its responsibility and made sure that childcare was available to all women, then we would not have a case where poverty, for example, is forcing women to go to work first before they can even afford to go back to work. So if a child is between 0 and 3 months old, the mother has not recovered even. They cannot, it's not time for them to go back to the labor market. But because of poverty, it's like if she does not leave the house and go and sell tomatoes, you know, sell sukuma wiki, there is no way she's going to have food on the table. So the first solution here is universal childcare, making sure that every child has access to affordable and quality childcare. The second thing in support of universal childcare is that we see the gaps that develop between children as they grow up. So if you come from a poor family, you have your parents did not have access to early childcare facilities, for example, you will forever remain behind, even in terms of catching up with other children. So provision of childcare is not only for the purposes of just having someone take care of you. Kids learn to socialize early. Kids pick up socialization skills, education skills early on. And the more time you take out of the early childcare facility, the more behind you fall. And so these inequalities, they are propagated throughout your lifetime. Your parent could not afford childcare for you. You yourself will not be able to afford childcare. And so this poverty cycle is replicated and it's repeated throughout the life cycle. So we need to get to a place where childcare is universal and every child is entitled to it, whether it's home-based care, whether it's an early childhood development center. The issue here is making childcare universal. Thank you.
Thank you very much. And I like the bit of free, public, accessible, quality childcare for all. Do we have comments from our online participants? Let us take the last round of questions. We have our sister from South Africa. We have our sister here from Ethiopia. This other side, no questions. Then we have our sister from Kenya.
Thank you so much for the insightful conversations to all our speakers. I was just triggered by the two previous speakers when they were alluding to women's care work and its classification in the informal and non-observed economy. There's a system called national accounts that is very clear, that gives a clear guidance on how gross domestic product should be measured when you are looking at both the informal and formal economy. But you'll find that this system is sitting in Federal Reserve banks of this country. It is not proactively and creatively used to give recognition status to the informal economy, where a lot of women's unpaid care work exists, but also that includes young women and girls fetching water and wood, the sex worker economy, but also street vendors and hawkers. And I think that if there is no proactiveness or a policy shift that gives recognition status to this informal economy that has potential and that is contributing millions worth of currency in the different countries' economy, we are going to fall short of doing the strategic campaigns that need to be done, because we cannot report on gross domestic product as just being the agricultural sector or the banking services. It needs to speak to the informal economy, because that is where the majority of the work and women's unpaid care work, most of these economies are actually built on women's backbones, but it is a non-observed activity. So it cannot just be a shadow national account system that does not represent the reality and the lived experience of women's contribution in the gross domestic product of all economies of this world. Thank you.
Thank you. Thank you very much. Let's come to our sister in the first table first. Because you have the mic, you can go on, then we will come to our sister.
Thank you very much. Good afternoon. My name is Nancy Gitonga. I am the CEO of African Women's Entrepreneurship Program, Zamora, and among others. Now, thank you, Ruth, and the team for really that good presentation. I'm just trying to have a look at this conversation and listen to it. And whether we like it or not, honestly, we have to speak a real truthfully to ourselves, because from the African continent cultural approach, the childcare, the care economy has been either naturally or I don't know how it was designed, but it was purely reserved for the woman or the female, because our girls are there in need. We've been really having a lot of campaigns, especially when it comes now to the economic approach. We are seeing women inclusion, women inclusion. I think the narrative here now is going to change, and we are going to say men inclusion. And the reason we are going to say this is because the truth is, our African men, you are seen doing a lot of tasks around the child care economy, all these things around that. The perception is there's a lot of stigma that goes with it, because a man is usually perceived to be weak doing the work that a woman is supposed to be doing. So how are we going to change this narrative? I think we're going to really come up with something that is going to create a lot of sensitization, a lot of influence on our men, so that we can have the men inclusion. So for me, I'm here asking, have we thought about this? Do we have a tool, or are we thinking of a way that actually we can have this advocacy and lobbying for the men inclusion to come into childcare? Because we need them, whether we like it or not. Thank you.
Thank you. Thank you. My sister, last comment.
Yes, thank you. I would like to thank all the organizers and the presenters for bringing the agenda. That's a critical issue for development of poverty elimination, the care economy. Thank you. And I'm Azim Kanawar from Union of Ethiopian Women and Children Associations. I just want to reflect on how are we relating the care economy with the social contract we are having. See? Because we all know that how the care economy is contributing to the general economy, also to the GDP. But the social contract we do have. What I mean is that how the social community or the social contract is identifying or classifying the care workers as women's work, as the women's work that have no contribution for the development, for the economy, for alleviation of poverty. We are talking about the identity of women given by the social. We need to have to change the identity or the contribution, the role of women to the economy. Because this care economy is contributing, has a significant contribution, even in some countries up to 30% of GDP, something like that. That needs research. So what I am talking is that we need a research. We need to change the narration we do have. As women have no role, women have no, or the unpaid care work or the care work have no contribution or role to the economic development. We need to change this narration in relation to the social control we do have. Thank you.
Thank you. Thank you very much. even as our discussant and the presenter respond to that, please also give your closing remarks in 1 minute. But then what I'm hearing from the two sisters is that if childcare remains invisible the way it is, then it will not be valued. If it's not valued, it will not be measured. If it's not measured, then there is no way the government is going to put investment in something that it doesn't see figures and everything. Yeah. So last remarks, let us start with Gonzak. You can talk about the questions that have come up or the comments, but just in 1 minute as you give your closing remarks as well.
Thank you, Madam Moderator. I fully support the participant who said that we need, one of the key issues, we need to recognize the work that happens in the households, unpaid work, done mostly by women, but not included in the national accounts. Paid work is included, but unpaid work is not included. And so this is why one of the things that we have been advocated as part of the Economic Commission of Africa for countries to undertake nationally representative time use surveys. And this also is one of the recommendations of Beijing Platform for Action. ECA is not just advocating, we are supporting Zimbabwe and South Sudan, Zimbabwe and Mozambique to undertake their time use survey. The importance of time use survey, Autash highlighted the fact that social norms is ungendered, and it derails all our efforts, all the policies that we want to implement, all the all the advocacy work in terms of promoting sharing an environment where we share the responsibilities for care work. But once we have the statistics from time use surveys and the statistics that Dr. Jacqueline has come up with, then we can monitor the trend, whether the advocacy, the policies that we are implementing is having an effect on that social norms, on that gender bias, which kind of keep the distribution of unpaid care work, unequal. Over to you, Madam Moderator. Thank you for the opportunity.
Your closing remarks, Dr. Jacqueline? You're on mute.
Yeah, thank you for the opportunity to present my research in this forum. And I do agree with the audience in terms of bringing men to the table. So this conversation cannot just happen among women. So there is need to bring men to the table and stop the stigma that goes with men in care work. There is need to change how we socialize young boys and girls in terms of care work. It's not a female role only. And also there is need to put a price on care work. And it needs to be recognized in the national accounts. And a lot of the work in the formal sector would not be possible if it were not for the care work. If there were no women who are ensuring that their men go to work, this would not be possible. So both men and women would not be able to work. So there is need to put a price, and there is need to include this in the national account. And there is no reason why this shouldn't be happening. And also there is need for more conversations to happen. But more importantly, let's not stop at the discussions. I think we have beaten the dead horse, and there is need for action and not just conversations. Thank you.
Thank you, Dr. Jacqueline. And finally, Lucy.
Thank you, Ruth, and thank you once again to Dr. Jacqueline and the team that did that wonderful research in South Africa that's beginning to position childcare. Mine is just responding to Nancy's question. I think I would just say I wouldn't agree. I could not agree more with you that we need to, our conversations on childcare and on the care economy need to be deconstructionist in nature. We need to really question, interrogate the gender roles and ensure that we are not engaging in, that our work does not actually reinforce the stereotypes that exist in relation to childcare and care economy. And it would interest us all to know that there are a number of organizations that are actually working with men on positive role modeling, on childcare in this continent of ours of Africa. As patriarchal as we are, we actually have organizations led by men that are beginning to really deconstruct some of these negative stereotypes and cultural practices that continue to make some of these care economy elements invisible or a preserve of women. So I am happy to share some more information on these programs that exist. Just my final comments, Ruth, if you would allow me. I have a challenge. One is a challenge to us because we have AERC here. I want to pose a challenge to you that the studies that we've done are really, really good, really rich, giving us very good information. And I want to suggest a bit of two aspects that we perhaps can look at in future. One is we've talked about this study was timely in that it looked at COVID-19 and its implications. And I'm just curious about the climate crisis. Several speakers have alluded to it. What are the implications of the climate crisis on childcare and perhaps the care economy broadly? And we would find that these women are the individuals, mostly women, that are providing care in contexts that are affected by climate crisis, floods, droughts, etc., are even more vulnerable and extremely invisible. We've gone to some of the camps in Kenya, and it's really a sorry state. The second aspect of research that I think would be useful to generate is just, we need to understand, in the Western countries, we have a lot of data that tells the story of how many children and how many women are providing care. And this goes to the point that was made by Gonzac and I think Dr. Jacqueline about this data then enabling us, and two of the speakers today, enabling us then to feed, feed these perspectives in budgets, etc. So if, just putting this on your table and hoping that you can support us in generating information that enables us to engage constructively with our governments and with communities as we develop policies, interventions together. Then just two things. I just want to emphasize the importance of public financing. I know it's difficult, there are competing priorities, but we believe that public financing is what will unlock the deadlock that we are seeing in childcare. For example, we also believe that public investments will actually help us to deconstruct, to create new narratives that are about how childcare should be provided in our communities, who should provide that care. They will open the doors for economic opportunities for those who provide childcare, but also those who are relying on childcare to re-enter the workforce. So I couldn't emphasize that more. And then secondly, the invitation to this meeting, as I said, is really, really well taken. Felista, it was a pleasure to meet you 2 weeks ago and, to have this come soon after. And of course, Ruth here, who have been so instrumental in trying to bridge the gaps, to build bridges between the different sectors. Let's build a bigger tent. Let's bring as many partners as possible. Let's facilitate partnerships, and we are happy to continue to be part of these partnerships because with all this crisis and all this, we are going to talk about debt and how difficult it is to recover because of what we are going through. But I think there's a strength in partnerships that will unlock some of the solutions to the financing question that we are facing. And then finally, there are so many studies. I've talked about a study, we've listened to a study today, and there are many others that are being undertaken by many of us, and many of our governments are also doing a lot of studies on the care economy. So the importance of a learning community cannot be underestimated. So let's find a way of creating a learning community so that we are sharing information and we are extrapolating examples to other countries and really just catalyzing solutions to the crisis of childcare. Thank you very much.
Thank you. Thank you very much to our discussant and our presenter. And I conclude by saying, before COVID, things were not okay. So we cannot be thinking about building back. We do not want to build back to where we were. We want to build forward to a more fairer, a more just society. And even as the government and the policymakers in the room think of very creative ways of ensuring that communities bounce back to where they were or build forward fairer, is childcare among the things that you're committing to focus on? Thank you very much.
Okay, thank you once again to Ruth and Lucy, Dr. Jacqueline, and Gonzague for their insights. Can we give them one more round of applause? A very rich and insightful conversation there that of course elicited a lot of reaction and feedback, which is exactly what we want in terms of the coming session. Some things that stuck out for me in that conversation was, one, childcare is a public good, so government support is necessary. And as Lucy had put it, public funding is necessary to unlock that sector. We need to dismantle social norms and stereotypes, as Dr. Jacqueline put it in her presentation. And the most important bit as to why we do this, childcare gives women the choice to engage in the workforce. And we already know what that means. When she is economically empowered, it not only uplifts her family, but her community, her society, her entire ecosystem that she operates in. So thank you once again. So time is well spent. It is now 1:32. We were supposed to have gone to lunch around 1, but I don't think we're complaining, because the conversation was really, really good. So what we'll do is we'll break for lunch. We'll extend it a bit because we were supposed to be back by 2, but I think we can be back by 2:15 if that's okay. Lunch will be served at the Asian Bay. That's the Chinese restaurant, lower ground floor. Again, lunch will be served at the Asian Bay. That's the lower ground floor, the Chinese restaurant. So if we can reconvene at 2:15 for the next session, that would be fantastic. Enjoy lunch. Thank you.
Thank you.
I need to make an announcement here. Oh, it's on. Okay, for those who are still in the room, if you haven't left for lunch yet, a quick announcement from the management team. You can leave your devices in the room. They'll lock the room. Your belongings, valuables will be safe. That is if you feel comfortable. But once again, this is an announcement from management. You can leave your devices in the room if you desire. They will be safe as the room will be locked during lunch. Thank you. Good afternoon. Good afternoon. I hope lunch was good. Thank you so much for making it back in the room. So we have 2 more sessions to go. We're in the home stretch of day 1. But before we get into our last 2 sessions of the day, I want to call on my Kenyan sister here, Wairimu Grace Ngugi, to take us through an activity. So hopefully it gets our energies up before we get into the last 2 sessions of the day. So Grace, the floor is yours.
Thank you, Victoria. Hi, everyone. When I say Grace, Grace, Ruth, Ruth, you must know your neighbor. So start knowing your neighbors. I know we have sat together. We don't know each other. So can you get to know your neighbor's name? Because you're going to do it. And I want us to, all of us, to stand. You can stop tweeting. Don't tweet this one. Eh? Okay, let's all stand up. Okay, we clap like this. We are going to do 2 of them. So we are starting with first knowing each other. Then we go to the next one, okay? No, let's do it again. So when I say Grace, Grace, I'm starting with myself and then I go to Rachel or to Victoria or to Ruth, okay? Hiya. And those who are not participating, I don't know why you're not participating. I'll know your name, don't worry, I'll come to you. If you are called and you don't respond, you come here. You are going to dance for us, eh? Feldas, come here, please. Please come here. Come here. Please come here. Whoever didn't respond to you, come here. Who is that? Can we repeat once more? And we keep the rhythm, eh? Aya, we start again. Okay. Rita. Okay. Aya, let's go to the next one. We were waiting for the director to come so that he can do that for us. Please come, Mr. Director, here. We do it with you. Okay. We are counting using our body part. Okay? So we are going to say 1. Say 1. 1. Can we do it better than that? Okay. We start with 1. Let me see. 1 plus 1 is equals to. Oh, you don't do like this. Thank you.
Thank you so much, Grace Wairimo Ngugi, for that energizer. I think we've burnt off a couple of calories from lunch, which is not something to complain about. Fantastic. So is Sindhu Kebede online before we move on to our next session? So we are starting just before 3. What we'll do is we'll allot 1 hour per session. We have 2 more sessions to go, and hopefully we keep within that time. All right, so we're getting into gender impacts of COVID-19, income, coping strategies, and food stockpiling. And this particular case study came out of Ethiopia. And this was co-authored by a couple of individuals. Sindhu Kebede, who will be presenting this particular case study, as well as Nigatu Geda, Admasu Maruta, and they hail from the University of Berlin, I beg your pardon, and the Addis Ababa University. After that, we'll have a panel discussion that will be guided by Dr. Olumide Ajayi from the African Leadership Forum. So do we have Sindhu online? Is he good to go?
Yes, I'm here.
So we can link up with him for that particular presentation and case study on Ethiopia.
Yes, I am here. I'm online.
Are you with us?
Yes, I am.
Okay, I can see you waving, but I can't hear you.
Can you hear me now? Hello?
There we go. There we go. So the floor is yours. We'll give you a few moments to take us through the case study for Ethiopia and then get into our discussion led by Dr. Ajayi. Thank you.
Thank you very much. I would now share my screen. Can you see my screen? Okay. Great. So I would take you through the presentation. First of all, thank you very much for giving us the opportunity to present this work to you, and also for the funding provided by African Economic Research Consortium and the partners to undertake this research. My team members really appreciate, and myself, we really appreciate the opportunity provided to us. So I would now go into presenting the work entitled Gendered Impacts of COVID-19 Pandemic on Income, Coping Strategies and Food Stockpiling using the case of Ethiopia. Okay, I'm trying to go forward. Yeah, so just a bit of an introduction. As we all know, the COVID-19 pandemic affected the global economy in general and livelihoods of households and individuals, in particular, both in developed and developing countries, even though the subsequent or the underlying reasons for these effects may vary depending on countries and their economic development. The rapidly evolving nature of the pandemic and subsequent preventive measures are the main reasons for this effect of the pandemic on the livelihood. For example, restrictions of movements, various lockdowns that influence the particular markets and livelihoods in general, and which have a subsequent effect on income of various segments of the population in particular. So that means this necessitates the analysis of the economic impacts of COVID-19. This is very essential to inform timely and adequate policy and programs to design intervention programs and responses. So having said this, this particular study aimed to analyze how COVID-19 pandemic affected the income of different segments of the population, the coping strategy that the different segments of the population followed, and also understand the different food stockpiling behavior of households at various levels. So our analysis used always a gendered approach. So we tried to disaggregate and look into different respondents from male and female households. The data that we used in order to analyze the aforementioned research questions are, we collected primary data using a telephone survey. And for this, we utilized 2 rounds of survey, quantitative survey. So to say, the first one is a rapid assessment survey conducted in April 2020 in Ethiopia. This was a mobile phone-based data collection. We conducted interviews with a total of 1,037 respondents in rural and urban areas of Ethiopia. But as you all know, especially the rural areas, telephone coverage is quite limited. So the data collection was more or less urban biased. So this was the first round of data collection conducted in April 2020. And then in October 2021, we conducted a second round telephone survey. And this time we did it on a subset of the round 1 respondents. So we followed the same respondents, but in round 2, it was about 453 telephone interviews were conducted. And these were mainly on with respondents from urban areas. And we kept the same respondents over time. Okay, so I will quickly jump into the results. We used, of course, various methods of analysis, descriptive analysis and econometric models, but I will skip that in the interest of this high-level policy forum. I will be focusing on the results and the implications of those results. So the first descriptive or the first aim is to analyze the impacts of the pandemic on income. So we requested respondents to tell us how their income reduced or whether their income was affected by COVID-19 pandemic. And the results showed us that about 50% of the male respondents were affected by income reduction induced by COVID-19 pandemic, and about 44% of female respondents were affected by income induced by COVID-19 pandemic. And we actually see here that it seems that there are more male respondents affected in comparison to female. However, when we dig deeper into the data, we find out that from the different segments or occupations that the respondents were engaged in, the most affected segment was daily wage employment and self-employed. So, and we tried to analyze who is mainly engaged in daily wage employment, and we found out that a higher proportion, about 13% of the male respondents were engaged in daily wage employment than female respondents, which was only 8%. So this means as COVID-19 pandemic kicked in, and due to this various restrictions of movement restrictions, various lockdowns, lack of market, lack of demand, lack of joblessness, and so on, this all resulted in affecting the daily wage employment and self-employed sector of the population. So that's what the next bullet says. The self-employed and the daily wage employment is particularly vulnerable to economic shocks, such as COVID-19. And this was because of the different containment measures that was utilized by different countries, as you know, the lockdowns, the movement restrictions, and the different mitigation measures that have highly affected employment opportunities and hence income levels of the self-employed and daily wage employed sectors of the population. Now, coming to the second aspect, the coping strategies, we further analyzed if a respondent tells us that they indeed have a reduction in income due to COVID-19, we then ask them, so what did you do in response to that? What kind of measures did you use to combat the reduction in income? So that is the coping strategy aspect of it. And our finding shows that most of the respondents reported saving as the most utilized coping strategy. As you see it here, it's highly utilized, or the most reported coping strategy, so to say, against income decline. And when we compared this between male and female respondents, we find that about 70% of male respondents reported saving in comparison to 64% of female respondents. And this shows that there is actually a disparity in because they only can report saving if they have some saving, right? So we kind of have an inclination that the female counterparts have less formal saving, and hence their financial inclusion is quite limited. And this is also supported by previous research that males are 16.6% more likely to have formal saving and use it also for emergency purpose as compared to females in general in Ethiopia. So this is one important finding. When we come to other types of coping strategies, what we find are mostly, as you see from the graph here, strategies such as reducing food expenditure and non-food expenditure. And as you see, that is more utilized by female respondents as compared to male respondents. So reduction in food and non-food expenditure is used as a coping strategy more by female than male respondents. And these are the numbers as you see them. The female respondents tend to use a lot of this type of coping strategies. And as you know, these are strategies that are highly directly linked to food security status, especially food expenditure reduction means it reduces the amount of the diversity of meal available, the number of meal intake and so on. And if this is used as a coping strategy, this has a direct and a serious implication on food security status of the household. Another aspect of coping strategy is access to formal and informal credits. And from our data, we found that we kind of zoomed into, as I said earlier, the daily wage employed respondents and try to analyze their access to formal and informal credit because these were the ones highly affected by COVID-19 pandemic. And here we find a very interesting result that about 50% of the male respondents who were involved in daily wage employment had opportunity of accessing formal credit. But when it comes to the female respondents, this was lower. It was about 38%. So having access to formal credit, it's more accessed by male respondents as compared to the female respondents. And when we come to informal credit, we find that again 54% of the male respondents engaged in daily wage employment as compared to 46% of the female respondents engaged in daily wage employment that used borrowing from family and friends. So this is the informal credit. So what we kind of, from this result, from this descriptive result, what we see that access to both formal and informal credit for those engaged in daily wage employment is consistently lower for female respondents as compared to the male respondents. So it seems that there is also, again, an inclination of the issue of financial inclusion is an issue when we come to female respondents based on our data sets. I'm sorry. So another interesting finding is that a larger proportion of both male and female respondents used borrowing from family and friends as compared to using credits from formal institutions. So in general, without disaggregating by male and female, what we also see that use of informal credit is more often utilized as compared to formal credits when we come to coping strategies in response to income reduction induced by COVID pandemic. So whether we see it in general as an access to credits, formal versus informal, again, there is an issue of more informal credits utilization. And then again, when we come to comparison between male and female, we see that the male respondents have more access to formal credit as well as informal credits as compared to the female respondents. Now, coming to results on food stockpiling, we find that there appears to be insignificant variation among male and female respondents in stockpiling food since the release of the news about COVID-19 pandemic. So we asked them, since you heard the news about COVID-19, have you bought much more than your previous purchase or your routine level of purchase? Have you increased the amount of purchase? So the issue of food stockpiling is what we wanted to capture there. And what we find is about 1/4 of male and female respondents have stockpiled food items. So in both male and female respondents, we do not find a variation in the amount of food stockpiling when we come to COVID-19 pandemic. But what is actually more interesting is what are the main triggers of food stockpiling. So for those who did undertake food stockpiling, what was the critical factor to initiate their behavior to undertake food stockpiling? And the most important factor that we find is respondents' opinion about food price increase due to COVID-19 pandemic is positively and significantly related to food stockpiling, which means if the respondents have an opinion that there will be a food price increase coming, then they would likely undertake food stockpiling. So this was a very important and the most significant factor that we found. We also found that elderly or higher age, those respondents with a higher age are not likely to undertake food stockpiling and so on. So that is where actually we undertake an econometric analysis, and this was the most important. So opinion adjustment or expectation adjustment is something that has to be done in order to manage the food stockpiling behavior of individuals whenever such kind of pandemic issues arise, such as COVID-19. Okay, now coming to the third results, we also requested respondents to tell us the number of hours they spent on productive, reproductive, and domestic activities before COVID-19 and during COVID-19. And here we actually find a very interesting result. Just to explain, productive activities are those that generate income, so formal employment, or as was discussed in the before lunch session, this is the labor force, joining the formal labor force. The reproductive activities are more like childcare and caring for the sick, yeah. And the domestic activities are the cleaning and the cooking and so on. So these are the results that we find. We asked them how many hours did you spend on these various activities before COVID-19 and during COVID-19, because when we did the interviews, COVID was already ongoing. So we asked during COVID-19. So as you see, the difference is there, of course. Before COVID, the difference between male and female number of hours on productive activities are there. As you see, male spend more hours, 8 hours, female 6, and the difference is, as you see, this one. And during COVID, of course, the number of activities, the number of hours spent on productive activities by male also reduced, but also by female reduced tremendously. So this is the difference between male and female. And we have all throughout these differences. And what we did is we conducted, or we kind of tried to capture the difference in difference. This is the difference in difference of the different activities. And these are the numbers I would like to explain, which actually provide a very interesting insight on this male, female before and during COVID-19 pandemic. So what do these numbers mean? When we come to productive activities, it means that then the difference between male and female, the difference on the number of hours spent by male and female before and during COVID-19 has increased by an absolute value of 0.25. So that means COVID has actually, the pandemic has actually exacerbated the existing inequality between male and female when it comes to productive activities. What about reproductive activities? The same. So the number of hours spent by females or by women on reproductive activities have actually increased. As you can see it here, 3.79, 4.42 on reproductive activities. So again, the difference in difference of these differences has also increased. And again, on domestic activities as well, yeah. What is also very interesting, why I left this last row, is because paid domestic or house help has actually reduced during COVID. So for male, 0.17 to 1.4, for female, 0.18 to 1.2. So actually during COVID, people tend to have less domestic help, which may be the case that women themselves are spending their time on domestic activities. So the same graph showing what I just said, to show you very clearly, for productive activities, hours have declined. For reproductive activities, hours have increased. And also for domestic activities, hours have increased. So females, especially when we compare females to male, females are spending less time on productive activities and more time on reproductive and domestic activities during COVID-19. Okay, I'm now finalizing my presentation. As a recommendation, what do we have? So we try to disentangle the recommendations based on the findings. Now, based on occupation, what we found is the segments of the population that are obtaining their income from self-employment and daily wage employment are highly affected by COVID-19 because their incomes have reduced tremendously. So these segments of the population, they need special focus while designing interventions as they are significantly affected by the pandemic. Financial inclusion, here we also, our data supports a very interesting evidence that we need to improve the existing gender disparity in financial inclusion in Ethiopia. This is evidenced from the saving opportunities. The use of saving as a coping strategy is higher for male than female, and also from formal and informal credit options, as we have seen. So for women, this gender financial inclusiveness is important. The third recommendation we have is based on implications on food security. As we have seen, more females responded using reduction in food and non-food expenditure as a main coping strategy or as a second set of coping strategy. And as I said, this has huge implication on food security. And this has to be seriously taken into account, because then the household's nutrition and food security situation is based on or mostly dependent on female members of the household, especially the female head. And so this has to be carefully taken into account. The last slide, public opinion about food price increments. Whenever pandemics arise, it's important to manage expectations of the public in terms of especially food price increases. So this is an important aspect to consider for policymakers concerned with food stockpiling. The other one is recognition and monetization of women's role. I didn't change my slide, but after I heard from the previous speaker, Jacqueline, regarding this issue, because we had the same research question in terms of number of hours spent on childcare, on reproductive domestic work, and so on. Her recommendation of this social norms or discussions of the society regarding women's role is also important. Also, that aligns with our recommendation as well, that women's role should be recognized and even monetized in terms of their productive role, reproductive role, and domestic role. Yeah, so more discussion around this issue is needed, and how to bring it forward to bring value to this role of women is also important. And finally, this is again to reiterate what I said, the pandemic has widened pre-existing gender inequalities and vulnerabilities in social and economic systems, which are in turn exacerbating the impacts of the pandemic. So it's important to address these inequalities using tailored interventions so that we come out better off than before after the pandemic. Thank you very much.
Thank you so much, Dr. Sindhu Kebede, for that insightful presentation. At this juncture, I'd like to invite Dr. Ajay to take us through the panel discussion.
Good afternoon, ladies and gentlemen. I would like the members of the panel to come and join me here. I would like to call Sebe Saba Grebemedin, who is the the executive director of NEWA in Ethiopia here to please come to the podium. I also would like to call Eileen Yinda from YWCA Cameroon. Please, can you come? But before we go on into the panel discussion, I would like to make some few comments about this study that we just listened to the outcome, the research study. Now, this study, when you look at it, if you actually change the name of Ethiopia and put many other countries, you are likely to get the same result. I'm saying that this result is applicable to many countries in Africa. Without much disparity, you are likely to get maybe the same result. The study not only showed the impact of COVID-19, income, and food stock planning, but it's also an amplification of the inequality that exists between men and women. And I think most studies of this nature need to be conducted on this subject matter, because when I look at what I call triple jeopardy for women, if you look at the inequality between the rich and the poor, if you look at the inequality between men and women, or you look at the inequality between the urban and the rural areas, women are disproportionately affected in all of this. So, and if you take some of the sectors vis-a-vis these three things, look at access to education, access to health, access to finance, that we just listen to, women are disproportionately affected in every area, even in food and nutrition. So I think Oxfam and African Economic Research Consortium should actually carry out and come up a study and come up with what I call regional inequality matrix to drive home this point. Take all the sectors, take all these areas that I've discussed, and do a mapping. You will discover that women are disproportionately affected in several ways. And beyond facts and figures is what I call data-driven activism. We need to be talking to member states with data, not just activism for the sake of it. We need to begin to use research and data to convince them, like what I said, that we need to do a matrix of how women are affected in every sector. We need to use figures, we need to use statistics to be able to demonstrate this in a manner that nobody can actually argue with us. Lastly, I want to say that before I call the panelists, that our policy recommendation, we need to begin to give what I call programmatic direction to them. What are the practical steps should we take, should the members take to rectify this beyond just giving them a policy recommendations? So in order to try and do justice, of course, to some of the issues that I've raised, I'm going to call our panelists to share with us their own perspective on these existing gender disparities. And the first person I'm going to call is my sister on my left, Seba Grebemendin. Did I call your name rightly? Do you agree? Okay. Who is currently the executive director of the Network of Ethiopian Women's Association. I've read her profile, and I know that she's a lawyer by profession. I think she has worked with the Office of Public Prosecution for like 17 years before coming to join the network. She also has a master's in gender and globalization and rights, many, many years of experience within the civil society, women rights and gender equality. She's a rights advocate, and she's going to use her experience to begin to talk to us this morning, this afternoon, on practical way that we can use or adopt to begin to close the gap in terms of financial access of women, because you see the study from Ethiopia has shown clearly that that gap exists. What do we need to do for women to be able to have access to credit and develop more resilience against things like the COVID-19 pandemic? You have the floor.
Thank you so much. Thank you, organizers, for giving me this chance to participate and give my inputs and share more from you. I think we have, I think this is the right topic, and I also want to thank the presenters. I'd like to thank Sinedu and the others who have done the study. Of course, we have been doing similar things, and since COVID-19, we have had some chances to discuss with women at grassroots level on how it has impacted them, and practically what the study findings have shown is what really happened with women in the informal sector, women especially in terms of their health, with women's access to reproductive health services, and including, as you said, the impact in education has really made most of our gains that we've made in equality for girls' education go back for many years that we have achieved. But coming to the economic part, especially women's access, I think we need to take stock of this lesson as a way that we need to build more resilience for women. When we talk about women's economic empowerment, I think most of us, including Oxfam and others, we have worked in that sector, and we have seen a lot of results. But where were these women when COVID came or any other crisis came? I think their saving level as well as their resilience was really hit hard. And that's why we saw even those women, especially in Ethiopia, the government provides a safety net program for people who are, for the poorest of the poor. And most women who have escaped from that level, who were actually earning something because of the saving and credit programs, I have seen going back to that level. But they were not part of the safety net program because they are considered they are earning something. But at that time, they have lost that earning because of the COVID-19 restrictions. Most women, especially a very small study that we have done with coffee, teas, those women who sell coffee and tea on the streets, women who used to go to people's houses and do laundries, commercial sex workers, petty traders have really been hit hard. But they were not part of the safety net program, so they were not being provided food and other items as a support. So that had made us learn a lesson, because women should move higher than the lower level of income, even with the good work that we do with economic empowerment. And that brings us to what Sinedu said in terms of access to finance. Because of collaterals, the requirement for collaterals, and the requirement, of course, for institutional some other procedures. For example, women in the self-help groups, which are very strong and which we see a lot of women organizations really doing fine with establishing self-help groups. They have a problem with establishing themselves and having a license because of legal and other processes. So it is about financial access to finance. It's about other institutional mechanisms that can provide a space. But the money that we give to women need to be better. Otherwise, they will go back to where they were. And I do believe in Ethiopia, it's not only COVID. I think COVID started a lot of crisis, social and economic, but also we had other problems as a country, which also created more inflation, more for poverty for people, especially with the droughts that we're seeing now and the conflict that happened in many parts of the country. It didn't stop on COVID. So the impact on social economy of women with disabilities and women in different situations has really exacerbated during this time. And it is high time that even as a government to think of other financial mechanisms that will sustain and really help women to come out of this poverty line, and also the empowerment that we see. Because if they don't earn, they're not saving and they are being compromised. I have seen how other crises are affecting women to become commercial sex workers because their income is closed, their businesses is no more working. So we're also talking about how they're becoming disempowered. All what that we have achieved is going back. So financial inclusion is a major response, but within that, there is a lot that we need to do in terms of building more resilience for women. Thank you.
Thank you, Saba. She's been able to explain to us that COVID-19 hit very hard on the resilience of the Ethiopian women, and that even women that have escaped poverty through increase in income over the years were pushed back into poverty. And one of the things that even complicated the situation of people in that group is that government did not make provision for them in terms of support, and the economic status of women became became worse. Then and the fact that they were not did not have access to finance again complicated those things, and that although the study did not cover other things, it was focused on COVID-19, but that Ethiopia has gone through many other pandemic in quote, the famine, the conflict that had actually exhibited its own pressure on women, and that as we are even discussing recovery, that we should take a better look at Ethiopia, that they need more than what we are discussing now in terms of support, because they are still in crisis. Thank you very much. I believe I gave a good summary of your presentation. We will go on to the next panelist, who will be speaking to us on how we can begin to deal with the issue of household nutrition and national food system in the face of crisis. Our next speaker is Dr. Ellen Yinda, who is a theologian, is a professor of theology. She has worked with the world headquarters of YWCA in Geneva for many, many years. She was the program director for Africa and the Middle East. She has gone back to Cameroon, like she said to me. She's now in the village. She's into agriculture with specific focus on plantain. And she has set up an organization that is called Woman Being to Woman Being. And she's also the president of YSA in Cameroon. Elaine also served as a member of the Standing Committee of Gender is My Gender. It's my pleasure this afternoon to give her the floor and the opportunity to speak to us, to share her experience. Good afternoon, Madame Elaine.
Bel après-midi. Je vais parler en français. Donc, vous avez quelques minutes pour mettre vos écouteurs. C'est une belle détente, hein? Je suis très reconnaissante de l'opportunité qui m'est donnée de réfléchir ensemble avec tout le monde sur cette question intéressante. En même temps, une question très pertinente à la lumière des résultats de la recherche qui a été faite par le docteur Kebede. C'est vraiment une question très intéressante et qui peut avoir les points d'entrée multiples, c'est-à-dire des réponses multiples suivant l'angle d'attaque. Moi, je vais vous proposer trois pistes à partir desquelles nous pourrons faire des recommandations encore ou des réflexions, surtout des actions pratiques. La première piste que nous connaissons déjà concerne la terre, parce que quand on parle de la nutrition, quand on parle des denrées alimentaires au niveau de la maison, de la communauté ou de la nation, il s'agit de la terre. Et la terre est un héritage ancestral commun des hommes et des femmes. C'est notre héritage ancestral commun. C'est dans ce sens que nous allons continuer toujours à faire le plaidoyer pour que les femmes aient accès à la terre et qu'elles deviennent propriétaires de la terre qu'elles cultivent. Et nous saluons également la politique de nos pays africains qui ont décidé d'octroyer 30% des terres aux femmes. C'est une très belle politique, mais la pratique est encore en chemin. C'est pour ça que nous continuons toujours à revenir et à mettre sur les tables cette question de l'accès des femmes à la terre. Mais cette question, par rapport aux réalités, moi que je vis, moi je suis une villageoise. Je viens d'un village du Cameroun qui est à peu près à 300 km de la capitale où je vis depuis. Et quand nous parlons dans nos causeries de la terre aux femmes, ce n'est pas une question évidente. Elles pensent que c'est une question très sensible pour qu'elles se mettent à demander la terre maintenant. Pourquoi? Parce que nos femmes dans nos villages et même nous-mêmes qui avons été à l'école, nous avons été formatés, n'est-ce pas, par notre société patriarcale à partir des valeurs, entre guillemets, socio-culturelles qui ne nous ont pas permis d'assumer jusque-là notre pleine humanité en tant que femmes dans nos communautés. Donc, c'est ce formatage-là qui demeure et qui a un impact, même pendant la crise que nous avons vécue, même maintenant. Parce que les femmes, surtout dans les villages avec lesquels je parle tout le temps, et étant en dialogue aussi avec les chefs traditionnels, c'est vraiment une question à laquelle nous devons adresser. C'est vrai que nous pouvons aujourd'hui continuer à demander que nos pays revisitent les codes de famille dans les pays. C'est-à-dire qu'on revoit ça par rapport, n'est-ce pas, à nos valeurs humaines qui nous permettent de nous retrouver et d'être pleinement humains dans nos communautés. Il faudrait peut-être également revoir dans certains pays les lois sur l'héritage. Les lois sur l'héritage et d'autres lois encore sur la terre. Par exemple, mon pays reconnaît sur le papier l'égalité du droit foncier entre l'homme et la femme. Mais jusque-là, il est très difficile pour une femme au village d'avoir un titre foncier. Donc, d'une part, nous devons continuer à mettre sur la révision des codes de famille par rapport à nos valeurs culturelles humaines. Dans un autre sens, c'est vrai qu'il y a cet impact négatif du formatage socio-culturel qui nécessite, je ne sais pas à quel niveau, mais je pense que nous pouvons aujourd'hui commencer à adresser cette question parce qu'on a l'impression que notre disque se répète, n'est-ce pas, sur l'égalité des hommes et des femmes, sur cette égalité du genre. Est-ce que nous pouvons, je crois que cela a été dit avant, nous engager dans une déconstruction de ce formatage socio-culturel dans une perspective de changement de mentalité. Parce qu'il faut que les femmes, elles sont capables de changer de mentalité et de se voir attribuer et être propriétaires des grandes terres. Et comment nous pourrons le faire? Peut-être, nous pourrons nous engager à construire des mentalités dans une perspective d'un féminisme créatif. Et je crois que cette idée la rejoint quand j'ai lu les futurs féministes. Donc, si nous pouvons nous engager vraiment dans un sens ou dans un autre, dans un féminisme créatif qui permettra de mettre sur la table et donner aux femmes leur pleine humanité. J'insiste dans ce sens, parce que si nous continuons à ne pas donner l'opportunité à ces femmes de se créer dans leur communauté, être capables, n'est-ce pas, de poser des questions qui ne les permettent pas d'être elles-mêmes, je crois que dans un autre sens, nos organisations, donc, voilà une question qui m'amène maintenant justement à parler de la nourriture, de la nutrition, parce que les femmes font de l'agriculture de subsistance. Nous avons parlé de la houe qui a été suspendue dans un musée, mais beaucoup de femmes dans les villages utilisent encore les houes. À quand la mécanisation de la production alimentaire pour soutenir les femmes, pour qu'il y ait vraiment cette production-là? Donc, il faudrait faire ce pas géant pour passer, n'est-ce pas, de la houe à la mécanisation et dans le sens aussi de soutenir que les pays africains soutiennent vraiment les femmes dans les chaînes de valeur agricoles. Et que nous puissions également, en nous basant sur les possibilités que nous avons toujours eues dans nos cultures de préserver, de conserver la nourriture. Il y avait des greniers dans des villages. Aujourd'hui, nous demandons le soutien pour que les femmes aient ce que nous appelons en français des centrales d'achat, donc des lieux où elles peuvent, n'est-ce pas, amener leur production et que le gouvernement investisse pour que chaque village ait cette possibilité d'avoir, n'est-ce pas, ce qu'on appelle une centrale d'achat, donc un lieu où elles apportent leur production, hein, pour que ces productions-là soient prises en compte et qu'elles reviennent aussi avec des revenus qui les permettent d'assumer leur quotidien. Je terminerai en parlant d'une autre question qui concerne vraiment ce lien que nous devons tisser entre la production, la distribution et soutenir les femmes dans cette perspective des chaînes de valeur agricole. Donc, qu'elles entrent dans la transformation et qu'elles puissent avoir, n'est-ce pas, la terre pour cultiver, qu'elles deviennent propriétaires de cette terre. Parce que si nous ne pouvons pas adresser la question qui concerne le formatage socio-culturel des femmes, je crois que nous allons continuer à faire ce plaidoyer d'accès des femmes à la terre, mais si elles-mêmes ne se mettent pas debout, donc il y a là un travail à faire dans les deux sens. Voilà, je pense que j'ai pu répondre à la question comment construire le système, n'est-ce pas, nutritionnel au niveau des maisons et puis au niveau national. Donc, nos pays doivent pouvoir mettre en application les lois et les politiques qu'ils prennent. Nos pays doivent soutenir les femmes dans l'investissement de la mécanisation de l'agriculture des femmes, puisque c'est elles qui produisent, c'est elles qui nourrissent, et que nous puissions rentrer dans une réflexion qui nous permette d'arriver dans un féminisme créatif, parce que ce sont les femmes qui sont créatrices, n'est-ce pas, de toute notre vie dans nos communautés. Merci.
Thank you very much, Madam Elaine. If I may just give a little summary of what we have just listened to her. She emphasized the fact that we cannot build a resilient household food system, even national food system, if we don't with the issue of provisions of land for women, and that member states should be compelled to begin to implement the AU decision on allocation of 30% of the farmland to women, and that is to again take a critical look at the family law and around the issue of inheritance. And she in fact has said that in our own country there is a need to ensure that men begin to adopt positive masculinity in ensuring that women have access to land. She spoke about the role of mechanization and how that can aid women to be able to produce more food. There is a need also for creation of buying centers in the rural areas to ensure that women are able to sell their food in competitive price and also integrate them to the agricultural value chain system to increase their livelihood. I hope I gave a good summary of your presentation. Thank you very much. We will go to plenary. I will go to discussion now. We want to ask any one of us that have issues to raise. But before I do that, as I was listening to our presenter, our researcher, about what really happened to food during the COVID-19 crisis, it occurred to me that it may be good for Oxfam and the other stakeholders to take a critical look at the ECOWAS Food Security Reserve Program. way back in 2003, I'd been part of the team that developed the Food Security Information System for West Africa, which after many work was done on it, led to the creation and activation of the ECOWAS Food Reserve System. I can say to you that during COVID-19, Nigeria, as big as Nigeria was, we had food crisis, and they had to borrow food from the ECOWAS Food Reserve System. So it might be good to take a look at it and see how this can also be replicated in other regions within the continent. Thank you. So the floor is open. If you have any question or any issue that you want to raise for our panelists, we will be willing to take you. Yes, ma'am. Is that Professor? Okay. Okay, there's another one in front of her. Okay, we'll move to this side later.
Thank you for allowing me. I'm Olabisi Aino from Nigeria. When my sister was speaking, I think our message threw up the issue that COVID-19 itself is now allowing us to reinvestigate. And I think our problem is not just the COVID-19, our problem is our ability to look at what went wrong even before COVID-19, the situation before COVID-19, because I think that is what COVID-19 is building on, that things were not right when we talk about the African woman. We have spoken a lot in the morning about policies and policy engagement, and we said it's a time to construct and to deconstruct. And I feel that maybe at this meeting, we need to clearly understand exactly what we're doing and where we're going. And I quickly raise my points. One is to understand the parameters that we have identified this morning. When we work women empowerment, when we are working on gender equality, and when we are working on social inclusion. And some of the time we work on women empowerment and we think we are actually giving an answer to the problem. What we are doing when we engage only with women empowerment is palliative. It doesn't change anything because the woman cannot herself change your system. So maybe as we do women empowerment, I think it's time to negotiate with the system. And that's what my sister is saying. There's something wrong with our governance. There's something wrong with the way we present our system. You know, there's something wrong, and without engaging with the system of gender inequality, why it is so difficult, without understanding that it doesn't matter what we do, we will always reverse back to where we began. And so please allow me to then let us look at what we are trying to do. For example, when we talk about food nutrition, I come from a part of Africa. Without COVID-19, families cannot eat, even when they don't have enough to eat. And yet we have tradition that tells us a woman does not eat this in pregnancy. A woman, when you cook, you give the best to your husband, even though you are pregnant or you are the best position to eat. Or you have to feel the boy child, you know, more than the girl child. Science tells us even the girl child has to be fed more than the boy child because of the issue of biology, of menstruation, of childbirth, and so on and so forth. So when we are not doing this and COVID also came, I was also thinking in this study that we'll look at, yes, we now have our food insecurity. Even the little we have, where we stockpile, how did we distribute it? Are we able to block tradition that does not allow us to give food out properly? Or is it re-echoing it? Is it really re-echoing it? And generally, I don't want to take much of our time, is that I think when we do gender research, we want to be obvious that we are not just engaging with quantitative analysis, because we then lose the team. You know, we lose the reasoning and we lose the real problem. We need to hear the women talk. We need to be able to balance quantitative and qualitative. And that is why we get the solution. That is where you are able to, I'm sorry to say, we just carried out a national study in Nigeria. And when we look at androcentrism, you know, we were shocked that it was coming from the women, even more than the men. Even when the men were saying, maybe we can change, the women will say, oh, that is how it is done. So please, so we need to negotiate, and we need to know that as we need to change the men, we need to change the women. And
Thank you, Professor.
Thank you.
Thank you. Thank you. We know that Pataki has his own evil, which also affects the thinking of women. So we got to exactly what you're trying to say. Please, can you go to the front and I will take 2 questions. Okay, you already have the microphone. Okay. Okay.
Thank you so much.
Dr. Vincent, you have the floor.
Thank you. My name is Dr. Vincent Ahonsi, and I'm the country director for Oxfam in Nigeria. I'm particularly pleased with the last speaker. If we are talking about equitable post-COVID recovery, this cannot be done by just looking at some issues and leaving the core problems aside. And one of them is the issue of land ownership, which he has raised. Even to procure land when you have the money as a woman in some African countries is virtually almost impossible. And this is what a high level or a high percentage of women do, agriculture, in several communities. Now, beyond that is what we call land inheritance rights. Many women don't have rights to their husband, to inheritance, either from their husbands or from their parents, and that is what we need to look at. That's another issue I think we should be looking at as much as possible as stakeholders. And more importantly is access to financial inclusion and financial services. How many communities, how many societies do women have access to financial services? Okay, we have to bring this to the fore. Sorry, okay. We have to bring this to the fore. So without belittling all these things, we have to look at the core issues that are making women to be disadvantaged, women and girls. And we have to look beyond the norms. We know the norms. Where women have children, both male and female, they ask the male to go to school, they ask the female to go and cook for them. These are the problems. And they are all this patriarchal thinking, patriarchal way of doing things. We have laws and policies in Africa. There is the letter of the law, there is the spirit of the law. Our governments should now step forward. There's no way we can make a headway in Africa. We cannot talk about zero hunger in 2030 if we continue to put women behind. We cannot talk about halving poverty in 2030, which is just 7 years away, if we continue to treat our women the way we are treating them. These are the core issues we think African governments need to step up their games and stop giving lip service to women equality, women empowerment, and all the other ones. Thank you so much.
Thank you. Please, I would like to urge other speakers to actually give us recommendations. What would you like us to tell the member states around this issue that we're discussing? And I also want to implore Professor and the doctor that spoke to kindly please give us a recommendation each on the issues that you have raised. What do you want us to tell the heads of state as we move towards the summit in February? Thank you. So can you give the microphone to her?
Sorry, if you start from me before I quickly drop the microphone. Where the laws are not available, this needs to be promulgated. And like a speaker spoke earlier in the morning, where we have federations, countries where you have the federal system, you have the state government, you have the local government, where laws needs federally had to be adopted or domesticated to the states or local government. This have to be done. We have to continue to think of how do we move forward. We have to stop this issue of this is our culture. Any culture, any norm, any tradition that does not make women to prosper, that does not know that women have the same right as men, that law or that custom needs to be done away with.
Okay.
That is the starting point. The moment you have to know that what is good for the man is good for the woman. God created them men and women, and they are both as useful as each other. And we have to, when we have children, we train both male and female. Why then do we see male outside as better than females outside? This is where it starts from. And there are some culture in some countries, they say it's our religion. I think any religion that continue to put women down it is high time the society has to be looking at the religion twice and say, is this really the religion we want to bestow on our children, our children's children? I think that is the starting point. Thank you so much.
Thank you, sir. I think what I can get from him in terms of implementation of decisions and policies and laws that come from the African Union is that the member states should integrate their subnational entities into this implementation process. They need to cascade this down. That is what is very clear as a recommendation from what he has said. Madam, you have the floor.
My name is Gloria Tere from Trademark East Africa. I was picking up on the issue of land as well. I think that the complexity of ownership inheritance is going to be with us for a long while. What I want to suggest, which is working actually in some of the cooperatives I work with, is leasing of land. Women are leasing land in Kenya, in Rwanda, so that they can't change some of what is happening in terms of inheritance. But if they are empowered to lease land, then the production continues, and they are doing it as cooperatives. So maybe the entry point is around cooperatives and the legislation that enables them to access finance or other forms of financing. But I think we should start talking about leasing as an option. Even big producers are leasing land. Thank you.
Okay, thank you very much. I think maybe another recommendation that can come from that, if I will help her to craft it very well, because this is what I do, is to say that the AU should encourage the member states to develop legal framework that will allow women to form land cooperatives and assist them to lease land with necessary financial support. Did I? It's a recommendation. Thank you very much. Next person. I will allow the panelists to speak later, but we're just trying to get out some. Go ahead.
Thank you very much. So just to give context, on behalf of the situational analysis in South Africa, is that whilst it is important to recognize the progressive laws that have been implemented over time on land's rights, they do like land redistribution, land reform, land restitution. And the most radical policy shift that we have seen is the amendment of Section 35 of the Constitution, which is about expropriation of land and property without compensation. But all this policy jargon does not necessarily translate to the equitable distribution of land and empowering women, especially women in rural areas. In South Africa, the context is very advantageous to rural women in that they are still subject, to have a male counterpart when they want to access land, because there's the traditional rural governance layer that is still imposed upon women in rural areas, that if they want to access land, they must present themselves in front of the chief. And still, they can't get the land if they do not have a husband, or they do not have a brother-in-law, or a family representative that is a man that must come and plead her case on her behalf. And even then, whatever gains that she is going to produce from that land, she has to guarantee that community jobs and so many ridiculous barriers, that rural women are subject to. And I think the presentation, the reason why in that presentation we are seeing women at the receiving end of credit, of access to credit facilities, is exactly because of that. Women do not have a bargaining tool such as land to present when they want to have credit given by banks and so forth. Thank you.
Thank you very much. Because what you just echo is also what Dr. Vincent did echo. We need to begin to work to break down all these traditional barriers. I also want to ask, I don't know what happens in other African countries. These traditional rulers, don't they derive their powers from the government? No. Okay, that's a major problem. Okay, I will take the last one, and then allow the panelists, because our time is up. Any other hand? Okay, let's give the floor to our panelists to round up with their response to those issues. 2 minutes. 2 minutes.
Just to come as recommendations and from what participants already have said, especially the issue of land. Yes, it's very important because it's a sort of property, and it's finance as well as it's a source of income. For Ethiopia, I think we have gone a long way in terms of legal revision, and we have good policies in terms of land, which ensures both the man and the woman to have access and to use land. But what we have is the implementation challenges, and we have tried to tackle those. So maybe in terms of land as a common challenge, I think from African leaders, what we should expect is more accountability in ensuring land access, ownership in other countries, ownership and use of land for women, whether it's implementation or whether it's a policy, or whether it's, if we don't have laws in some countries, then having those laws. The second is about creating enabling financial services, both geographic in terms of amount, in terms of procedure, in terms of collateral, what you said. These are major challenges for women not to move to the next level of economic status. And if they don't move, then they, after some time where crisis comes, they're going to lose. So I do believe that we should have, even in terms of taxation for women in the informal sector, our taxation policy should be revised, our credits policies should be revised, and providing services. So I think this can come up with recommendation. But one final thing is not also to lump all kinds of women together. We need to have more disaggregated type of information. For example, women in different situations, women with disabilities, women pastoralists, and women in different kind of capacities. We need to have a more disaggregated, informed decision for policy recommendation as well as for legal recommendations.
Thank you. Dr. Eileen, 2 minutes.
Because, je vais parler en français. Je prendrai 1 minute parce que le résumé a été bien fait par les contributions. Je reprends. Le résumé a été bien fait par les contributions parce que nous devons vraiment prendre à bras le corps la question de l'accès de la terre pour les femmes parce que c'est un héritage commun. Et puis qu'il faudra voir dans quelle mesure nous allons également apporter le changement de mentalité, hein, pour que les femmes, hein, et les hommes soient au même niveau d'égalité, hein, dans leur communauté. Hein, dans tout. Et surtout qu'au moment des crises, c'est toujours les femmes qui portent la grande charge de notre communauté. Donc, ça a été bien résumé. Et moi, j'ai parlé d'un féminisme créatif à venir, pas d'une masculinité positive. Parce que la masculinité positive vole avec une aile. Il faut un féminisme créatif à venir dans les futurs féministes. Et puis, nous disons que la nutrition, la sécurité alimentaire repose sur les femmes. Elles ont toujours été créatives et surtout en temps de Covid où les enfants étaient à la maison, où elles avaient plus de bouches à nourrir et moins de moyens. Donc, il faudrait voir dans quelle mesure aussi les gouvernements vont prendre la question des femmes rurales pour qu'elles aient aussi une certaine protection, hein, dans leur communauté. Donc, je crois qu'en résumé, c'est ça. Et qu'on continue à investir sur les centrales d'achat dans nos villages et que les gouvernements changent également, révisitent les codes de famille, les lois sur l'héritage. Donc, l'Union africaine fait déjà beaucoup pour le genre, mais je crois qu'ils doivent permettre aux pays membres de mettre en application les lois et les politiques dans lesquelles ils s'engagent, et surtout pour l'égalité du genre. Voilà. Merci pour tous les bons résumés qui ont été faits.
Thank you very much. We are rounding up our section. And I think the summary of everything that we have said this afternoon is can be put this way, that increasing the resilience of women in building good and functional household and national food system rests on the need to give women access to land and more access to finance. The government should implement laws that remove traditional barriers to access to land, supported with sound accountability mechanism. I would like to thank all of you for listening. I would like to thank our panelists and also our researcher who opened this discussion about 1 hour ago. Thank you and God bless you and good afternoon.
Once again, to appreciate our wonderful panel that was moderated by Dr. Ajay from the African Leadership Forum, and of course, Madam Saba from NEWA and Madam Helen from YWCA for their great insights when it comes to access to land, financial inclusion of women, to give them a fighting chance when it comes to their empowerment journey. This is a perfect segue into our next session, which will look at mainstreaming gender for enhanced COVID-19 rural livelihood recovery. And we'll be looking at the case in Zambia and what they had to do in terms of protecting land rights for women there and how they engaged in terms of agricultural land. We have Simon Manda from the University of Zambia. He was the author of this particular case study. He's joining us online. I hope he is linked in now. And after which we'll have a session that will be moderated by Amudath Mazu from WILDAF. And they'll be joined by Esther Mwaura from Landesa and Awotash Alemu from the Intergovernmental Authority on Development, or IGAD. Simon, I hope you can hear me from your end. I can see your presentation. The floor is yours.
Thank you so much. Good afternoon, everyone. I'm so glad to be here to join you virtually. I hope I'm loud and clear.
Yes, yes, you are. Go ahead.
Okay, thank you. So I'm glad to be here. May all protocol be observed. So we're looking at mainstreaming gender for enhanced COVID-19 rural livelihood recovery in Zambia. I should mention that Zambia seems to have taken a little bit of a different approach. When about 80% of countries across sub-Saharan Africa were closing their borders and locking down, Zambia was a little bit hesitant to do so. And it comes out later on that probably this was quite helpful in not only sustaining rural production and markets, but also in ensuring food provisioning for urban consumers. So this research was underpinned by three main important questions. At the first level, we were trying to analyze in what ways COVID-19 impacted rural livelihoods across gender, and what has been the impacts of COVID-19 on well-being, specifically material well-being, material acquisitions. Secondly, relationships, intra-household relationships and inter-household relationships, and more widely community relationships. And looking at people's perceptions on how the government responded to the pandemic. At the final level, we were looking at how can support for rural women be organized to ensure resilient and sustainable livelihood recovery. The third question was getting into also finding ways through which land use dynamics were changing, and also how land rights were being affected or protected where possible. I'm on my third slide now. I hope my slides are moving on your side as well. This is a case study from Zambia, as we have already heard. We looked at a specific case study which was in close proximity to the epicenter of COVID-19, which was Lusaka, and as with other countries across the sub-region, COVID-19 seemed to have more generally been an urban dynamic. So we looked at a specific, agricultural belt, which was about 150 kilometers west of the capital city, Lusaka. 74.9% of this study area, called Mumbwa, is rural-based and agriculture dominates. We have a few activities around small-scale mining and the like, vis-a-vis the expansion of the Chinese investment, but agriculture remains a dominant agricultural activity. And our focus of our research was across 3 important study sites, and we deployed household surveys, group discussions, and household interviews, which we were calling household case study interviews, as well as interviews at different levels within the national sphere, regional, and district level. In terms of the outcomes of the research, we note that in terms of the government response to COVID-19, although the government made a decision not to lock down the country, there seems to have been what we can call too much politics in the air. The preoccupation of the government seemed to have been on economic recovery itself, but very little attention on rural recovery. The focus on economic recovery looked at government interventions in terms of stimulus package. It looked at government policy restrictions on importation and the like, entry requirements of not only goods and services, but also people themselves at a macro level. Rural recovery was coming in a way a bit indirectly through specific general government interventions, such as social cash transfer and the like. And at this, what we see is that there appears to be indirect support with no particular attention to women experiences and the like. But the general argument here is that a focus on economic recovery and a focus on getting the economy right in improving production or in maintaining production and market dynamics did not have a particular women dimension to read, except in a few occasions, especially in the NGO sector, NGO interventions, that we saw a bit of gendered kind of interventions. So the fertilizer input support program, for instance, that has been channeled or has been advanced by the government, did not make particular provisions for the different experiences across gender. And what we see here is that in our results, the impacts of COVID-19 are being viewed as stemming from the impacts of the policy responses themselves and not the disease, more generally speaking. The policy responses, such as those around social restrictions, movements, market access, and the like, impacted rural households differently, but across 4 main important areas. We see, or the results show, that the policy responses affected the relationships and the social networks in communities that we studied. This affected initiatives such as village banks, and women were unable to meet and make contributions around village banks, which affected their profitability potential. And we see that impacts in terms of the changes in the relationships affected previously relied upon fallback strategies, coping mechanisms in terms of access to food and the like was affected due to changes in the relationships. Even intra-household distribution of food, distribution of responsibilities was also affected. At a second level, we see the impact of policy responses across production and markets. And this, I think, is a very important lens through which we can see the impacts of COVID-19, production and markets, economic activities more generally, which affects the material well-being. What specific assets did women have before COVID-19 and what did they lose due to COVID-19? So we saw disruptions not only in the input supply markets, but also, let me repeat that point. The disruptions to the input supply relates not only to the policy response, but also to the fact that economic activities, slowed down, and women were unable to produce and acquire incomes for them to buy inputs for fertilizer. So we saw, impacts on input supply, but also disruptions in the markets. Disruptions in the market specifically meant that women were unable to go to the markets, but basically because they were also more likely to adhere to COVID-19 guidelines. And we saw some people in our study mentioning that men were brave because these were able to abrogate COVID-19 guidelines and still be able to go to the markets. And what we see here is a reconcentration of men in not only production spheres, but also a recentering, a reconcentration of men in markets. And this drives household inequalities, and it also drives inequalities across gender. So we see material aspects where, are affected, input supply, access to production, and again, incomes are being affected across gender and market access as men were now dominating. In terms of input access, we saw men flexing their financial muscles at the expense of their women and getting into the production spaces that were previously for women. At a third level, we see disruptions in membership schemes, social initiatives that brought not only brought women together, but social initiatives through which women were participating. And impacts on membership meant that they were unable to belong, is to specific groups that maybe guaranteed them access to inputs. Specifically, cooperatives such as the Fertilizer Input Support Program, which is a government initiative, due to disruptions in production and inability of women to get into markets, and due to lack of income, women were unable to pay for membership fees to access inputs for agricultural production. So what we see here, ladies and gentlemen, is that women are facing blocked pathways. They're facing blocked pathways in terms of membership, in terms of mobilization of resources, in terms of mobilization of inputs, in terms of mobilizing themselves as a collective to advance a specific interest. At a fourth level, ladies and gentlemen, we see changes in intra-household food provisioning, intra-household labor division, and care burdens. And with the closure of schools that we saw in Zambia and elsewhere, children that were previously in schools retreated home, and women that were able to get into markets and production circles retreated home as well. Women reported an increased caring burden, increased burdens around household provisioning, and the like. And one of the things that we also noticed was a few women reported increased household numbers. The number of household members increased as some of their relatives in the urban Lusaka were sending the children to the rural side for the rural women to keep on their behalf. As we know that Zambia was also facing a deteriorating economy as it defaulted on the Chinese loans and facing an increased debt burden. Another feature that we noticed was that some of the children, girl children, were being sent in other rural areas, such as on the northern side bordering Tanzania there, where they were able to go and work in precarious environments during the period that schools were closed, and heightened number of girl children as well getting pregnant in between, which is also driving inequalities between boys and girls, with girls facing much bigger challenges than the girls. So what we see is that overall, women are more likely to lose their livelihood options due to COVID-19. And the way in which land rights were being protected during this period is quite indirect, with no clear-cut interventions on protecting land rights for women and the like. So women quickly lose their livelihood options. They retreat home and they get relegated to household work, which is unpaid and they're also invisible. And the policy responses, ladies and gentlemen, here were more macro, and they failed to drive a resilient, resilient rural livelihoods, so to speak. So agricultural and gender-specific interventions were generally missing. And I'm thinking here, in terms of mainstreaming gender for enhanced COVID-19 rural livelihood recovery in Zambia, there are four main pathways that emerge from our study. The first one is that there appears to be the need for policies that can promote gendered access to savings and credits. And this should be a clear-cut and intentional government direction from the outset during pandemic. At a second level, there's need for gender-sensitive agricultural policies, including markets, as part of long-term livelihood recovery. And this should be gender-sensitive. At a third level, we're calling for a need to promote social protection, social cash transfer with a specific gender dimension. At a fourth level, the study is calling us to build multi-level and progressive partnerships and collaborations, state institutions alongside NGOs and volunteers, together providing agriculture and livelihood support assistance to rural women, as opposed to seeing disjointed tensions and contradictions between who is doing what in the rural countryside or not. Collaborations and partnerships should therefore be built in order to drive rural recovery. I'm going to end my presentation with a quote that came across in Mozambique. So recently with Oxfam, I was in Mozambique, and we're commemorating Women's Day, and one of the women by the name of Rebecca Mabui, the president of Rural Small-Scale Farmers in Mozambique and National Secretary for Smallholder Farmers in Mozambique, said the following: "Why do we speak? To whom do we speak? To whom do we cry to? Who is listening to us? What should we do? But in all this, all I know is that rural women suffer and suffer a great deal." Thank you, ladies and gentlemen. I'm willing to listen to your additions later on. Thank you.
Thank you so much, Simon Manda from Zambia, sharing the case study from his country. I'd like to call on Amudath Mazu to take us through this particular panel discussion.
No? Yeah, it's okay. Good evening, everyone. My name is Amudat Mazu, and I'm from Benin. I work for WILDAF, Women in Law and Development in Africa, based in Togo. Before I start, I want to share with you a quote from Nelson Mandela. Nelson Mandela said, "When you want to talk to a man in a language that he understands, that goes to his head. But when you talk to him in a language, in his own language, it goes straight to his heart." So allow me to take this moderation in French, as I'm representing Francophone countries. So, OK. OK. So, bonsoir à tout le monde. Je suis très heureuse de contribuer à cette session sur la problématique de l'intégration du genre pour un meilleur établissement post-COVID des moyens de subsistance dans les milieux ruraux. C'est un plaisir pour moi ce soir de recevoir Madame Esther Mouora de Landesa et Aotash de Alemo. Il faut reconnaître que lorsque nous prenons la plupart des études qui sont menées en faveur des impacts de COVID, très peu d'études arrivent également à intégrer les questions du genre lorsqu'il s'agit des problématiques liées à la subsistance des femmes rurales. En effet, la pandémie de la COVID n'a pas seulement décimé des milliers de vies, mais elle a également laissé des milliers de ménages, des femmes veuves, des femmes sans boulot, des femmes sans moyens d'existence. Alors, pourrons-nous toujours continuer par mener des politiques non sensibles aux gens et qui ne prennent pas en compte le fait que les femmes sont fragilisées, les femmes qui sont dans des ménages et qui dirigent les ménages par elles-mêmes, les femmes qui sont devenues des veuves, les femmes qui sont célibataires, des femmes qui sont handicapées. Allons-nous continuer par mener des politiques sans prendre en compte ces catégories de personnes? Alors, notre collègue Monsieur Simon Manda a réellement mené une étude qui nous amène vraiment à aller vers le cas de la Zambie, où l'étude a réellement pris en compte une perspective de la dimension genre au niveau du secteur agricole. Comme nous le savons, au niveau du secteur agricole, les femmes sont les plus menacées. Les femmes sont les plus relayées au niveau inférieur, au niveau de la chaîne de valeur. Alors, dans ce cas, que faut-il faire? Comment est-ce que nos politiques pourront être mieux sensibles aux gens lorsqu'il s'agit du domaine de l'agriculture? Il a partagé avec nous quelques innovations qui consistent à encourager des partenariats, à permettre à implémenter des politiques sensibles aux gens. Et pour notre cas, dans le cadre du Togo, nous avons également essayé d'aller dans ce sens en rassemblant des parlementaires pour pouvoir les introduire pour pouvoir à la notion du genre et à la budgétisation sensible aux gens. Avant de continuer dans ce développement, je vais donner la parole à Madame Esther Mouora. Madame Esther, laissez-moi vous introduire Madame Esther. Madame Esther Mouora de Landesa est la directrice du plaidoyer mondial de la campagne Stand for Her Land. Elle travaille dans le domaine du développement local depuis plus de 28 ans. Elle est convaincue qu'un progrès durable n'est possible que si les personnes vivant dans la pauvreté et en marge du développement occupent une place importante dans la recherche des solutions à long terme et durables. Auparavant, Madame Esther a travaillé en tant que responsable des droits fonciers des femmes au niveau mondial pour l'ILC et continue à se rallier aux acteurs et au gouvernement mondial pour développer l'engagement collectif des femmes pour les droits fonciers. Nous avons également un deuxième panéliste, Monsieur Aotash Alemu Tefera, qui va nous... de l'IGAD. Elle nous vient de la Djibouti et elle est spécialiste du genre. Elle travaille depuis 1 an en tant que spécialiste régionale en genre pour le développement des affaires de genre de l'IGAD. Au cours de ces 17 dernières années, elle a travaillé sur les droits des femmes et le genre, l'intégration du genre dans divers programmes et projets, la prévention de la violence contre les femmes et d'autres domaines similaires. Alors, avant de passer la parole à Madame Alemi. Your name is Alemi. So, okay. Alors, lorsque nous prenons la pandémie de la COVID, nous avions dit auparavant que cette pandémie a fragilisé des vies, a dépourvu des ménages de leurs moyens de subsistance, ce qui demeure un problème pour la reprise après COVID. Alors, selon vous, comment vous pensez que les gouvernements, les communautés économiques régionales, si je prends le cas de l'IGAD, collaborent avec les États membres pour relever ces défis et autonomiser des femmes dans l'agriculture, en reconnaissant le fait que les femmes, depuis le discours qui est mené le matin, on reconnaît tous que les femmes sont les plus fragilisées dans tous les niveaux de domaine, au niveau des différents secteurs. Alors, comment est-ce que vous pensez que cette collaboration pourra avoir lieu pour pouvoir mener des politiques beaucoup plus sensibles en faveur de ces femmes, de ces personnes vulnérables qui se situent dans les milieux ruraux? Partagez avec nous vos expériences. Je vous remercie.
Thank you very much. It's a privilege to me to be here with you guys, with you today. So I'm not a very good protocol person, so I'm going to be a little bit informal, and I hope you're not, no one is going to mind. Thank you very much once again. I didn't catch your name, sorry. Mazu, thank you, Mazu. You were struggling with my name as well. So I think when we talk about African women, and particularly the women in IGAD regions, as you know, IGAD, we do have 8 member states and practically 7 committed member states. So my talk is going to be around those member states where IGAD is mandated to support. So when we talk about women in agriculture, I think it's obvious that in this region, most of the community are rural, particularly in IGAD region. So when we talk about agriculture, I mean, we can't really talk about women in IGAD without talking about agriculture, because most women are involved in agriculture. And as you know, more than 80% of food is produced by women in Africa. So that is mostly predominantly in the rural area. So what we do affects women in agriculture in general. So as IGAD, I know it doesn't sound very fancy, but I think COVID-19 climate conflict gives us, as much as it is challenging and as much as it takes away a lot of, it brings a lot of problems, but at the same time, we take it as an opportunity to deconstruct the pre-existing patriarchy and socioeconomic inequality, because when social structure is shaken, that's when we get the opportunity to bring in women into leadership. So as a feminist and gender expert, I've seen when there's when we come into those shaky circumstances, we change that as an opportunity to actually bring in women. And it helps us to start afresh. So as IGAD, we took this as an opportunity, COVID-19, and it was a very good timing for us also to develop our gender strategy. So we started questioning, how do we now bring in women into the picture? How do we bring in gender equality within our respective region? Then we actually asked that question because it was a moment where our region was seriously hit, like Zambia and other African countries. It's not an exception for us as well. And most women actually also operate in an informal sector. We were talking about women being involved in informal sector in the morning, and predominantly in agriculture. So we're developing our gender policy, which would enable us to build the capacity of member states. And that strategy, so it's not a policy, we do have a policy, but our strategy is now being designed in a way it responds to not only climate change and conflict, because our region is also hit by conflict, and we do have recurrent conflict and drought, but also COVID recovery situations. So COVID has been taken as one of the core discussion points for us to develop our gender strategy. The gender strategy is still under review process. So if you look at, once it's of course official, if you look at our strategy, it has a lot of coverage on COVID, and we're taking it, like I mentioned, as an opportunity to bring in women into the public sphere, into the agenda, and bringing in gender equality in our respective regions. So mainly our mandate is to build the member states' capacity to undertake programs, interventions that are gender responsive and that are gender transformative as an umbrella. So using this policy, so using this strategy as a guiding framework, we also do mainstream gender in all our key intervention areas as IGAD. We do have, as you know, we are a secretariat, but at the same time, we're supporting our member states in different areas, in economic cooperation, agriculture, climate change, peace and security, and other areas. So our main target is to ensure that gender is mainstreamed in those pillars, in key pillars of our interventions. Like I mentioned, particularly in agriculture as well, and also improving or empowering women to access to have access to land. That's also our huge intervention area where we're working on gender and land governance, where we're targeting and building the capacity of member states to ensure that women have access not only to land, but also to land governance, where women will be able to be part of the governance system as well, and come into the leadership when it comes to land governance. We also have women-specific interventions where we support women in blue economy. I'm sure most of you know what blue economy is. IGAD has a huge program intervention on blue economy, and women are also part of that blue economy, and particularly they are working on fishing industry. So women are being supported to be able to have economic empowerment, to be able to be economically empowered and self-sustained. We do have specific interventions also on women who are having trades in cross-border areas. We do have cross-borders. Our member states, as you know, include Kenya, Ethiopia, Uganda, South Sudan, and Eritrea. So those member states, we do have cross-borders, and most of the cross-border traders are women. So we also have an intervention where we are trying to build the capacity of those women in cross-border areas to have skills and knowledge, but at the same time to have access to finance, access to credit, and also to support them to overcome non-tariff barriers. As you know, there are a lot of non-tariff barriers that limit women from being economically empowered. We also just launched a new project, a new pilot on building the capacity of women entrepreneurs in our member states. And that's particularly to support women to have the required skills and capacity to become strong women entrepreneurs, where they would be able to change their lives and their families. So we've launched, we have more than 25 members now who are going to be trained virtually, but this is a pilot where we're planning also to extend, to expand our targets once we see how it works. Because this is actually a huge challenge. Women entrepreneurs lack not only access to financial resources, as we were discussing throughout today,
but at the same time, they also lack, the required skills and capacities. And we're not networking them with successful entrepreneurs where they get mentoring and training from them and experience sharing. So in a nutshell, those are the areas that we are trying to mainstream gender and empower women economically. So like I mentioned, agriculture is pretty much everywhere of what we do as IGAD.
Thank you very much. Merci pour les initiatives que vous avez menées dans le cadre de l'IGAD. Oh, don't worry. J'ai cru comprendre à travers tes développements que il est important que nous puissions nous reposer sur le développement des politiques agricoles beaucoup plus sensibles aux gens. Et vous avez également parlé du fait qu'il est vraiment urgent également de repenser à cette manière dont nous intégrons la question du genre dans nos programmes et politiques et également nos pratiques. Étant donné qu'en Afrique, nous sommes dans une société assez patriarcale et la question des normes et des cultures impacte fortement les niveaux d'existence de ces femmes. Alors, parmi les différentes politiques que vous avez menées, plus concrètes, puisque ici, nous sommes en train de vouloir donner des recommandations au gouvernement, à l'État, de façon plus pratique. Lorsque nous prenons, par exemple, l'accès au financement, quel a été le mécanisme qui a été utilisé à ce niveau? Ça, c'est ma première question. Et lorsque je prends ma deuxième question, parce qu'il est important, beaucoup d'organisations renforcent les capacités des femmes. Il est vrai, nous devons renforcer le leadership des femmes, oui. Mais lorsque nous renforçons le leadership de ces femmes sans leur donner des moyens d'existence capables de leur permettre de sortir de ce cercle de pauvreté, alors est-ce que nous pourrons sortir vraiment de ce cycle de pauvreté qui continue par peser sur la population africaine et surtout les femmes? Alors, que deviennent ces femmes après les formations? Lorsque vous finissez de former ces femmes, que deviennent ces femmes? Est-ce qu'il y a souvent des suivis pour pouvoir je prends l'exemple de cas d'un programme où vous avez formé les femmes. Que sont devenues à l'heure actuelle ces femmes? Parce que lorsque nous prenons des politiques sensibles aux gens en faveur de ces femmes, nous devons à terme et à long terme avoir des impacts qui constituent non seulement à améliorer leur niveau de vie, mais à avoir également d'impact sur la génération future. Alors, quelles sont les politiques mises en place pour pouvoir atteindre non seulement la génération présente, mais également la génération future, c'est-à-dire les actions de long terme? Je vous remercie.
Thank you very much once again. Yeah, I know it is. I mean, we could kind of infer recommendations from the kind of talks that I had, but at the same time, that those are very specific and challenging questions. And I think we every day we come together and talk about them, we train them, but what's next? We do have different policies and strategies. Then, so what is the question we always have? So it is a very important question. And I think I also believe in that, that we should not be always talking about and training. I think just to approach your questions from a little bit of, I don't know, experts' point of view. So to transform gender equality, we have talked about social norms change, which is very crucial because social norms change is very important, where we have a society that believes in gender equality and use the existing resources fairly between men and women. And that can only come when we have a society that's transformed and perceive gender equality as an important component. So I would think that's very, very important and very crucial to do. And often I'm challenged with this question, like transformation begins within us in this room. And how many of us believe in gender equality, and how many of us are don't tend to go to our cultural and social norms subconsciously. Even us who are talking about gender, who are talking about women's rights, who are talking about gender equality, we often find ourselves doing the same thing over and over. So I strongly believe in transformations, and which we are doing. And that's why capacity building is very important to our member states. And we are doing that because this is a root cause, and the root cause is power. Gender is about power. So unless and until we bring in that power equality and power share, we are not going to change the situation of women in our region or in Africa. Because no matter how much we continue giving women resources, if we don't change, if we don't transform social norms, then we should continue doing that over and over. Because economic empowerment by itself doesn't bring liberation. And I have seen that as IGAD and as a gender expert. And sometimes it can even become source of conflict unless social norms are changed. But just to answer your question, do you want to have a follow-up? Do you have a follow-up question, or do you want me to answer your specific questions? Because you have asked me very concrete questions. So I was going to come to that.
Oh, sorry. I don't know if we have Madame Esther from Landesa online.
Yes.
Oh, okay.
Yes, I am.
Je vais vous donner l'opportunité également de parler de cette question. Et comment vous pensez que les gouvernements peuvent-ils rétablir les moyens de subsistance des femmes sur les marchés de travail et également au niveau de la chaîne d'approvisionnement agricole pour favoriser la résilience des communautés? Donc, nous voulons quelques recommandations à l'endroit de nos gouvernements et également de l'Union africaine. Merci.
Thank you. Thank you for that great question. I'll try and keep my camera off so that I'm not falling off from this meeting. And I just want to appreciate having been invited to be part of this panel. Sorry that I could not be there in person. I'm actually fighting COVID. I got infected in COVID in Egypt. So, but I'm back in my country. My name is Esther Moira Moiro. I work with LADESA, and I'm the Global Advocacy Director for the Stand for Halal campaign. And the Stand for Halal campaign is a global initiative that is pushing for the implementation of policies and laws regarding to securing women's land rights in the world. And so that question is very relevant to the work we do and the work personally I'm responsible for. And I will start from where the Simon left. And Simon gave us a very good analytical understanding of what the research he did in Zambia found. And to me, this also resonates with what this morning and early afternoon, many presenters talked about, that COVID didn't bring us anything new. Actually, COVID, the restriction of movements and the cessation did not show us anything different that we did not know. What it did is actually to show us the magnitude of inequality that exists. And so my proposal are not going to be fundamentally new, because what has happened is that we continue to give a recommendation, but unfortunately we are not too sure that these recommendations are getting traction in terms of implementation. And the first recommendation, I'd say, borrows from Simon's argument that while most of the women farmers, particularly grassroots women farmers, were impacted, they quickly bounced back. They quickly bounced back, and in any case, they were anyway feeding the families. So what did that show us? That it showed us that if our continent is able to feed our own families with quality food, with enough food, and we are able to feed our own villages, then we are also able to feed our own country and feed our own continent. And therefore, governments need to invest in local farmers and local women's ability to strengthen their production of food at the local level and be able to grow the establishments at the various value chains. A case in question here in Kenya, in Nakuru, the women who were producing milk, and they had milk coolers close by them. They did not throw away milk. They were able to feed their families with milk and nutritious food thereof, and they were also able to supply for food when a minimum of opportunity existed to take things to the market. So that's very important, that we need to invest on farmers to be able to contribute quality food for our own consumption, even before we think about exporting, that we need to have quality food and adequate food and sufficient food for our families, for our villages, and therefore for our countries. The other what COVID taught us is that those farmers that were able to have food that they could supply and package well and have good and they could actually be able to transport, though with the restriction, to the right market, they were able to sell. And so what we are recommending to the government is that particularly government-based institutions like health institutions, training institutions, administrative institutions must prioritize buying from local farmers. Those institutions were able to access quality supplies from farmers at that time when transport was not available. And so we need to make sure that our first priority is offering the opportunity to sell goods and commodities, especially related to agriculture, to our farmers. And that, I think, it's an investment local governments, but also national governments need to emphasize.
Thank you, Esther.
Can I just say
beaucoup.
And I just say them quickly. And the third one, and I know we are lost with time. The third one, and everybody has talked about small scale savings and credit, but we also understood that actually women bounced back and they started giving each other savings and credit. We need to put enough money in the hands of the women, in hands of these savings and credit. And I cannot stop before I talk securing land rights for women. Over and over again, we have heard that many women lost land during COVID times. We now know that in our continent, less than 2% of women can say they control and own land. How can they continue feeding the family? So let's secure women's land rights. Thank you very much.
Comment ils peuvent continuer à nourrir les familles? Merci beaucoup, Esther. Je vais redonner la parole au public. Ici, ce soir, ce que nous allons essayer de faire, dans la mesure où tous les pays sont représentés et que nous sommes à court de temps, nous allons prendre quelques contributions des pays sur que faut-il faire pour une meilleure intégration du genre au niveau des moyens de subsistance afin de favoriser la reprise du COVID. Merci beaucoup. Nous allons prendre quelques interventions et prendre en compte les positions de chaque pays. Le Bénin est représenté, le Ghana, le Congo, Côte d'Ivoire. Merci de nous proposer des solutions concrètes que nous allons compiler et envoyer aux chefs d'État et à l'Union africaine. Merci.
Merci. Je suis Julie Koné de la Côte d'Ivoire. Je suis aussi de l'ECOSOC. Donc, ce que je voulais dire d'abord, c'est que la COVID n'a pas vraiment changé des choses. Ce que la COVID a fait…
2 minutes. 2 minutes.
Merci. Je peux maintenant? D'accord, merci. Donc, je disais que je suis Julie Koné de la Côte d'Ivoire et aussi de l'ECOSOC de l'Union africaine. Pour commencer, je voulais dire que la COVID n'a pas vraiment changé beaucoup de choses. Ce qu'on peut dire réellement, c'est que la COVID nous a montré exactement que tous les mécanismes, tous les protocoles qu'on avait mis en place, qu'ils étaient fragiles. Ils étaient fragiles parce que dans plusieurs séminaires, on a vu que la femme africaine avait vraiment avancé, qu'il y avait eu beaucoup d'avancées, il y avait eu beaucoup de choses qui allaient de l'avant. Mais la COVID nous a montré que il n'y avait vraiment pas de structure solide en faveur de la femme. Donc, quand on prend le cas de la Côte d'Ivoire, par exemple, il y a des lois sur l'accès à la propriété foncière. La femme, autant que l'homme, peut accéder à la terre. Mais ce qui se passe dans la réalité, c'est que ce n'est pas le cas. Ce n'est pas le cas parce que nous avons encore des stéréotypes, nous avons encore des idées reçues comme quoi la femme ne peut pas vraiment être propriétaire terrien. Mais ça, je pense que c'est une question de monitoring aussi des lois que nous mettons en place. Parce qu'il ne s'agit pas seulement de promulguer les lois, mais il faut se rendre compte si vraiment de manière effective, ces lois-là sont vraiment appliquées. Et ça, c'est vraiment au niveau de chaque pays qu'on doit faire ce monitoring. Le premier monitoring va se faire d'abord au niveau même de l'Union africaine pour savoir si tous les protocoles qui sont proposés sont vraiment pris en compte par les États, quels sont les États qui ont signé, quels sont ceux qui n'ont pas signé. Et parmi ceux qui n'ont pas signé, continuer la sensibilisation et le plaidoyer pour que ça soit fait. Mais de ceux qui ont signé, est-ce que vraiment les lois ont été vraiment mises en exécution au niveau de leur pays? Si ces lois ont été votées et promulguées, mais qu'est-ce qui est fait réellement? Et moi, je pense que le plus dur, surtout en Afrique de l'Ouest, c'est dans la pratique. C'est dans l'exécution des lois que nous signons, nous votons. Et dans plusieurs cas, nous avons des choses qui sont effectives, même pour l'héritage. Aujourd'hui, quand une femme perd son mari... Pardon? Quand une femme perd son mari, c'est prévu qu'elle puisse hériter aussi, qu'elle puisse avoir droit à l'héritage pour la succession. Mais dans les faits, ce n'est pas encore le cas parce qu'il y a encore les coutumes, il y a encore les stéréotypes. Donc, c'est vraiment ce monitoring-là, ce suivi que moi, je préconise qu'on puisse faire.
Merci beaucoup à la Côte d'Ivoire qui nous recommande de mettre en place des systèmes assez solides à la femme pour permettre l'émancipation de la femme. Et quel autre pays pourra nous donner quelques recommandations? Oui.
I take the express permission of my Director of Women Affairs to speak on behalf of Nigeria. Nigeria has put together a number of policies in the gender sector. I think those policies should be cascaded to state and local government level. We also have the policy, the national policy of social protection. If you look at that policy, it talks about women, or it does not engender the protection policy itself. And I think the policy was written even before COVID. I think it's a time for us to revive the social protection policy and ensure that we are not just mentioning women, but we are actually engendering. We bring out the gender issues across all the statements of the policy. That will help us. And I know that presently, even by court, the court says that a woman can inherit from her father. In some of the ethnic groups, women cannot inherit from their fathers. And that case was one. And I think it should be used as a stepping board to push on the inheritance right of women, including land. If we can do that, that also will help us. I'm not sure whether the...
Thank you very much for your contribution. We have Nigeria, Côte d'Ivoire. If we could have 5 more countries to wrap up, that would be great. Yes, please.
Thank you for the great discussion. My name is Foro Bebo from Kenya.
I have a contribution to make regarding a potential solution to increasing resilience. I give an example of women in the northwestern part of Kenya called Turkana County, where there are several programs post-COVID that are geared towards using their cultural heritage of some of the, enterprises they have had for a long time. And one of the enterprises they've had is basketry. So the women have been trained on modern ways of making baskets. There are some efforts to support marketing and ensuring that these women are able to profitably gain from the trade. The county government has even established a market for, basket items, and they're supporting them in the pricing and in the marketing. The other thing we've seen through local administration systems, women are able to negotiate to take particular sections of value chains. For example, in Turkana County again, which is actually the poorest county in Kenya as per statistics, the women are being, they are being supported to engage in trade of goats. So they are able to go buy their goats, they are able to slaughter their goats and sell the goats. So while the men engage in several other sections of the value chain, such negotiations within the society, without, as we move towards equality, can begin to give women some breathing space. Thank you.
Thank you so much. Which country?
Kenya.
Kenya, thank you so much. Yes, please. I hope our rapporteur have been recording all the recommendations for us.
Sorry, I don't speak as a country, but I wanted to speak up on something you mentioned when you're saying training, so what? I would like to recommend that we revisit how we measure impact. I think many times we look at quantitative measures, has income increased, have people, access and all that. But I think there are things that are changing that we may not be capturing. Sometimes accessing a training in itself is a transformation. Some women don't have access to training at all. So I think we need to revisit how we're measuring impact, because I think we are losing a bit of the story while we're waiting for these big things to happen. Thanks.
Thank you so much. Do we have any other hands?
Thank you. I just want to say that for us in Malawi, we do have a women economic empowerment strategy, but it expired last year. So for our own recommendation, we'll review that strategy and try to incorporate as much as possible the recommendations that are coming from here, which are very good. So we will embark on that. The other issue that I wanted to just flag out is that in everything that we're discussing here, I see a lot of corrupt activities at all the levels, starting from community level all the way up. So we should also try to come up with some recommendations to deal with corrupt activities so that gender equality becomes a reality. Thank you.
Thank you so much. I will now come to our discutant to give the last remark. I will start from our researcher, Mr. Simon Manda.
Yeah, thank you so much. I hope you can hear me.
Yes, please go ahead.
I think it's interesting to see with what has been discussed, shared experiences across different countries. And I think what I'm taking out here is, what IGAD said, that maybe there'll be need to look at opportunities that have been brought about through COVID-19 pandemic to reflect on the structure and organization of these economies, our societies. What is it that makes men take over certain decisions and take over certain resources? And what is it that makes women lag behind? It should be able to help us reflect on those structural inequalities within these societies. And I think I like the recommendations coming through land rights, issues to do with governance, and issues to do with integration of women at the center of policies and the like. So I'll leave it there for now, but I think this is a very good conversation that allows us to reflect on those structural inequalities that have existed in our different societies.
Thank you so much. Madame Esther.
Thank you. I think listening to the countries and also listening to what has been shared today, definitely we've been doing good work. It's just not enough. And we do have great plans that are already in place. So I'll suggest that we continue building on what works, but also make sure that we are accelerating progress, because besides everything else, we see new challenges emerging. And if we are not we are not moving in great speed, we might lose all the gains that we've made. And I would say implementation of the commitments that as African governments that we have put for ourselves, and diligently making sure that the women living in poverty are at the center and the leadership of our investment.
Thank you so much. So up to you. Over to you.
Thank you. I think other speakers have all said it, and we have heard a lot of recommendations. I just would like to again reiterate the issue of monitoring. I think we need to monitor what we're doing and capture results and focus on evidence-based interventions and stop doing the same thing over and over and over and expect different results. That would be my conclusion. Thank you.
Merci beaucoup aux panélistes. Merci beaucoup à notre chercheur qui a apporté une lumière sur la question qui a été pendant délaissée dans la recherche, et actuellement ça a pris, et nous pourrons nous en inspirer en tant qu'organisation de droits des femmes pour pouvoir avancer le travail que nous faisons. Alors, je retiens principalement comme recommandation ce soir le fait qu'il urge à l'heure actuelle de mener des actions étatiques pour promouvoir l'accès des femmes à l'épargne et au crédit, de renforcer les relations intraménages pour accroître la participation des hommes aux soins domestiques. Il est également important de promouvoir les politiques agricoles sensibles aux genre, promouvoir les politiques de protection sociale, notamment à travers les transferts en espèces, les allocations pour les enfants et les repas scolaires sains. Les initiatives d'hébergement doivent être également repensées. Les initiatives d'aide alimentaire, de soutien au maintien et à la reprise de l'emploi et à l'aide financière. Il est également essentiel que les gouvernements travaillent en étroite collaboration avec ces travailleurs et ces personnes qui sont effectivement dans le besoin. Je vais ajouter finalement que c'est vraiment important que nous établissions des mécanismes pour pouvoir rendre les responsables à divers niveaux comptables de la mise en application des différentes politiques et programmes qui sont mis en œuvre afin de pouvoir mieux intégrer le genre dans les programmes, les politiques pour pouvoir favoriser la reprise de post-Covid. Alors, je dirais comme mot de fin qu'à l'heure actuelle, nous devons repenser l'avenir de notre environnement et nous attaquer aux impacts du genre sur les moyens de subsistance avec plus d'ambition et d'urgence. Ce n'est qu'à cette seule condition que nous pouvons protéger les moyens de subsistance, surtout pour les couches les plus défavorables, nos mères, nos femmes, les handicaps, les femmes qui sont chefs de ménage, les femmes qui sont veuves, qui sont seules, qui sont sans mari, célibataires. Nous devons repenser toutes nos politiques et réellement les intégrer dans nos actions. Alors, c'est à cette seule condition que nous allons pouvoir réellement atteindre l'égalité du genre, promouvoir l'égalité du genre dans nos divers systèmes, et notamment les systèmes agricoles et d'autres également. Je vous remercie pour cette brillante conversation ce soir et j'espère que les recommandations issues de cette brillante discussion seront mises en œuvre à divers niveaux. Je vous remercie.
Thank you once again to Mazu and a fantastic moderation there. Very refreshing to have a French speaker doing the moderation. I really, really enjoyed that. And of course, thank you once again to Esther Waura and Awatash Alemu, and of course, Simon Manda, who helped set the tone for that particular discussion in the case study from Zambia. A lot has been said today. I will do my recap in full tomorrow morning. But before we close, because we've come to the end of day one, can you imagine? It's been a fantastic, I think that deserves a round of applause. It's been a fantastic, full, rich, robust day in terms of the discussions that have been going on. But I'd like to invite my namesake from Oxfam, Victoria Wamalwa, who will take us through a few points that we need to know in terms of support from donors and other partners as well. So Victoria, the floor is yours for a few minutes, and then we will close and I'll give you a brief into what we can expect for tomorrow. 5 minutes. Okay, fantastic. The floor is yours. She will be here in 5 minutes, so that's 5 minutes to fill. Fantastic. Okay. A lot has been said, and of course, the case studies that were shared today, Ethiopia, South Africa, and Zambia, were just a precursor into what we can expect. Tomorrow, we'll hear from what's happening in Kenya and Nigeria with regard to their COVID-19 experiences and how it affected women in their respective countries, but a few of the common threads in terms of what was recommended, discussed throughout the day. Number one, challenging and dismantling social norms and gender stereotypes. And this, I guess, coming from the bottom. Kenyans would appreciate the phrase bottom up from a political standpoint. But when we talk about dismantling social norms, it has to start from the community level. And that is the responsibility of those who live and move in those spaces. Another key point that came out was advocating for women's land rights. That is something that we can't ignore as we move forward to think through policies that would further empower women. Financial inclusion of women is a non-negotiable. So whatever avenues that we need to use in terms of ensuring that they are part of the conversation, they are at the center of policy when it comes to their economic inclusion, women have to be part of that conversation. Empowering them as they engage in agricultural activity. They are the majority players in this space. And so we need to kind of look around how to further empower them and uplift them in their agricultural activities, focusing on evidence-based interventions, answering the so what question. Why do we do what we do? And I think that was a fantastic point that was raised both by Mazu and by Awatash in terms of the programs that exist. So hopefully we can reflect on the findings and the recommendations through the evening. It's a chance also to think through what that means in your respective spaces, in your respective countries, how to start agitating and advocating. I believe it was Dr. Ajay who said we need to have data activism. It needs to be driven by numbers when speaking to governments. So I saw a hand up. If you want to contribute, of course, we have a few minutes before Victoria comes. I'd love to hear from the rest of the room.
Yes, thanks so much. I think there was one key issue that is usually not thought through carefully. And this is to do with the issue around the unpaid care work. And I think there was quite a lot of emphasis around the issues of women in the informal sector. I thought that needs to get visibility. And there are also issues that were discussed to do with the social norms. I thought I would make that contribution.
Thank you. Thank you. Any other contributions from the day? Yes, coming to you, sir. Data-driven activism. Thank you. Thank you, Dr. Ajay. Any other contributions from the day before we wrap up? Observations. Yep.
I would say that it's a great presentations from the moderators. And it's speaking to all the countries represented here. So I could connect with my country, what Zambia, Ethiopia, South Africa are talking. It happened also to our other countries like Kenya. So it's a learning process, and it's something that the research was well done. Thank you.
Thank you, Grace from Kenya. Anyone else? Okay, see a hand there. We'll come to you. Go ahead, Dr. Korir.
Yeah, thank you. There is only one, of course, the presentations were great. There's only one element I didn't quite get the detail. There was a mention of women having lost their pieces of land as a result of this COVID. I didn't quite get the country and the context, because from the Kenyan experience, I don't think that would happen unless otherwise. I thought we could spend 1 minute or so to give a highlight of that so that we can get to know more.
Yeah, so I think that there is potential in the room to come up with creative ways and strategies to position women who are small-scale farmers through them plugging into the African Free Trade Continental Agreement, because currently I think that it is a space that is consumed by commercial farmers, but I also think that it should open up to more rural women's livelihoods, because it is the most social justice actors in the room are the ones that actually are working with rural small-scale farmers, as opposed to government. But I also think that space is not explored enough. It is not popularized, but it is also not socialized.
Thank you. I believe one of the contributors, Dr. Korir, to your point, I'll have to dig back in there, had mentioned how several women had lost land during the COVID-19 pandemic. So we'll need to find who made that contribution and get some clarification from them. Any other comments, questions? Yes, Honorable Rita from Uganda.
Thank you very much. For me, out of COVID, one that sits with me is the issue to do with the teenage mothers or the unwanted pregnancies that came out very, very hugely. I don't know whether it is my analysis. I didn't hear that ring very much, but that issue cuts across all the issues we have highlighted, whether it comes to trade, health, whether it comes to agriculture. It actually pushes majority of all those that became victims, and most of them not by choice, into the areas we are trying to highlight. So for me, I feel it's one of those that should get to the table, because it kind of reverses all the milestones we have made in terms of gender equality promotion all these years. Thank you.
This is just a contribution. As researcher, translating policy recommendation from research has always been an issue between researchers. And I'm really happy to see how IRC has put everything together to make it happen. I think this session is a starting from how to make those recommendations, policy recommendations, into concrete action in such as we can have impact in people's life, transform people's life. And I'm really grateful for this action. And I would like also to urge all of us to not take it to this point. We should move beyond this room and go to the grassroots women, rural women, and share those policies, recommendation with them and help them translating it into concrete action so that this can really impact their life, so that they can also be involved in all those actions we are taking. Thank you so much.
Thank you. Thank you so much, Mazu. I believe Victoria is in the room. The floor is yours as we wrap up this session. Thank you.
Thank you, Victoria. Good evening, good afternoon. There's coffee, tea outside. We are preparing to give a meal allowance for the dinner, but we are just getting started. So I'll request that we break for tea. Then after that, we will be ready to start making the payment. In the meantime, for the local transport reimbursements from your home to the airport and back, my colleague Joshua, please let the people see you. Please give Joshua the receipts for the transport reimbursement, because we reimburse based on the exact. For the meal allowance, kindly, you will give us your boarding pass, and that's what we'll use to calculate the days as we make the payment. So in the meantime, we can break for tea. Once you're done, then we'll come back, we'll have started. Thank you.
So just a quick clarification. Can we release people for the day? Right? Yeah, because it just, so they know they can